at this time, there's this side effect. But with these services, you're able to learn, uh, en- engage and involve them in your day-to-day living to ensure that you have healthy living. Thank you.
Thank you very much, Dr. Foz. I think we are all in agreement that from now on, or from today going forward, we're not going to call this complementary medicine. And it's nice to know it's coming from an actual medical doctor. And also to understand that these complementary, I'll say that for now, you'll forgive me, but these alternative options are being integrated into medical healthcare right from the start. So that brings us to the role of, you have something to say? Okay. Dr. Ismail would like to add on to that.
So just for the sake of Dr. Fauzi's comments, so sometimes when it comes to treatment, there's different stages of treatment. So from the patients that were treated, a lot of patients coming from the medical side, they give them pain relief medicine. That medicine goes on, it only covers the symptoms. It doesn't treat the cause. So then you end up, long-term effect on that, people start having kidney problem, heart disease. So in terms of complementary, we do agree, or me personally as from Activate, I agree, complementary medicine and also conventional medicine put together is very good. There's stages for it. So for instance, like if someone was about to have surgery, that's conventional medicine. So there's a stage where conventional medicine will stop, and then complementary medicine takes over. Complementary medicine, it means it complements towards the conventional. So it's not something that's separate. So to me, in my argument, in regards to you, I still think complementary medicine is it has its spectrum. So it should not be as the way you said.
Okay. Thank you very much, Ismail. Dr. Foz, you have something to add on?
No, I agree entirely, Sena. And I think the point I'm trying to put across is that as much as one supports the other, and there is a phased manner in how care is given, is that at the start of care of any patient, we ought to have all the teams from the start in terms of the comprehensive assessment and care of this patient. Each of the two play a very significant role, and I wouldn't like for this care to come only at the end. I would want for a care to be from the start. I should know that I will have surgery, I will have physio sessions. After the first 12 hours post-surgery, I should have so many sessions. This will help me to avoid clots, to keep the physical activity of the body, keep my muscle tone, and then I should know that post-discharge, I will continue with my sessions for maybe the next 5 days, and the following week I'm back to work. So I don't want it to come at the end. I want it to be a discussion had from the start. Thank you.
Okay. Thank you very much, Dr. Fouz and Ismail. I think it's very important that they've noted those, and we're going to have a separate session that's going to speak to growth and the future of complementary medicine and how we can have all partnerships put together so that we can realize its importance. But let's move on now to the role of physiotherapy. And I'm going to bring in Peter here. The question to you is, how do complementary therapies accelerate recovery, rehabilitation after injuries, surgery, or chronic illness?
Yes, hi. So, I mean, my views will be from the UK specifically, how we sort of approach the healthcare system. Going back to what the doctor was saying, I think it's quite important. The approach that we use is early on, early intervention, looking at the patient after surgery, what's the aftercare. We also work in an MDT approach, multidisciplinary team, where it's not just the physios or the OTs, but as you know, the consultants will lead the way, and the rest of us will sort of follow. From a rehab perspective, because obviously that's what I specialize in, specifically sport, we use it, or I use it quite early on. Again, it's quite it depends because I naturally take the guidance from the doctors themselves in terms of when is it best to sort of apply. So if somebody's had a surgery or a total knee replacement, um, you're not really going in there to do any soft tissue work. You're not really doing any manipulations. It's not indicated. So that healing process has to be respected naturally as healthcare understand and know. But again, when the time is deemed appropriate, complementary therapy plays a massive role, especially in terms of the healing process, the early on, the acute phase, where we're managing swelling, we're trying to improve range of motion. But again, it's looking at the time frames that literature shows. When is it appropriate for us to do anything? Is it after 6 weeks? Is it 8 weeks initially? Um, but again, it's not something that we wait till the end to then introduce. It's just, the body healing itself and understanding that, what is appropriate, what's not appropriate. From a physio perspective, so looking at physiotherapy, we start quite early on. So especially anybody that's sustained any musculoskeletal injuries, fractures, dislocations, tendon repairs, studies have shown in the UK and across the world that early interventions, so getting the patient up, mobilizing, loading, activating initially, especially after the surgery, is very, very beneficial. In my company, what we tend to do is, liaising as an MDT, using an MDT approach, and working with our doctors and surgeons. We start early on. We re-engage in introducing that idea of exercise. So, when a patient comes to me after, for example, they had a fracture, for example, uh, we look at, what are the contraindications, what we call, what can't they do, and understanding, obviously, in terms of literature and so on and so forth, we respect that. But in that process as well of respecting, if they're non-weight bearing, for example, the things we can do. So in terms of complementary therapy, like, for example, massage, is it, looking at, you staying there ideal and not able to walk or not able to use that limb for a period of time, those muscles will naturally develop tightness. So we can offer that treatment as a result. So I think what the doctor was saying and, what Ishmael was saying were completely right. But because, we're not talking about one specific injury and we're talking about multiple injuries, in terms of where it fits in, it varies. It varies on the person, it varies on the injury. But the approach that we use in the UK is very early on. So, anything to do with getting the muscles moving, activating, loading, standing, challenging your cardiovascular is so, so important early on. I'm not sure how they do it in Uganda, and I'm really fascinated to know. And, hopefully by the end of this conference, I'll have an idea. But it's a combination of both, and it does. It's something that we do. Even early on into an acute phase, even if you're looking at something chronic like, osteoarthritis, these are all things that, and I think what the doctor was saying was right, it shouldn't be a complementary treatment. It should be something that's ongoing, part of the person's care and treatment as a result, yeah? People who are elderly I've seen, and, it works for them in terms of adding that massage, even if it's mobilizations, even if it's manipulations as a result. So complementary, I think if we're able to integrate that into like the healthcare system here, it plays a role both in acute, in that, chronic.
Peter, in my own experience, I got a fracture on my finger a couple of months ago, a couple of years ago. To an orthopedic doctor and get this checked out. But it was a simple fracture. And what he prescribed was a splint, which I had to keep on for about 14 days. And thereafter, after a check, he advised that I need to see a physiotherapist to go with the movement. So I get what you're saying, Peter. In the UK, with his experience, it's this complementary medicine or alternatives start right from the beginning. And that's information that I think needs to be out there. And that's the importance of this conference. We have Solomon in the audience. Solomon is a practicing a physiotherapist with the ABT clinic, and he has something to say in response to Peter or something to add on, right? Okay. Thank you.
Hello, thank you. Good morning. Solomon is my name. I'm a physiotherapist at ABT. Just to add on your experience in the UK and what is here in Uganda, physio, I think we act as a bridge between complementary and the conventional medicine. So mainstream medicine may not know about these other types of complementary therapies. So when a patient, like I would see a patient right from ICU, like OPD, but then after, what happens? The patient is going home or like discharging them to the community. They will ask what next. Probably they still have the pain, they're still not walking well, they're still having muscle weakness, and they're not able to come to the hospital. And like Uganda, complementary medicine has always been around. Like you've seen traditional bone setters, people fall and they recover. So this thing is not new, but like we don't know how to integrate it into the mainstream like medicine. So policies should be there, like which help bridge the gap. Thank you.
Thank you very much, Solomon. Again, when you speak to policy, when you speak to how this integration is going to be done, I think we're going to handle that in the third session of our panel discussion. Before we get into engaging the audience in the Q&A, I want to direct my next question to Leona. As someone working closely in the wellness space, we would like to understand how complementary medicine is changing the way patients and communities perceive healthcare in Uganda today.
Wait, so is this working? Can you hear me? Yes. Perception. I don't know if it's actually perception. This is working. Perception is to me. Perception to me sounds a lot like intention, like how people do things and then they say the intention wasn't to do that, but you did it. We don't judge your intention, we judge the action, right? So in as far as perception is concerned, as far back as 1930, the World Health Organization changed the health model from a biochemical model to a biopsychosocial model. Why? Because the killer diseases had moved from infectious diseases to chronic illnesses. It had moved from tetanus, polio, diphtheria. Some of us did these things in primary school long ago. So it had moved, the killer diseases moved from that to chronic illnesses, which is still the problem today: diabetes, hypertension, cardiovascular disease, cancer, name it. And so the whole health model changed at that point, and this is when professions like my own came in, because it's part of the health model. Now, when people think about the health model, they only think about disease and physical illness. But it's much more. I think complementary medicine should be seen as preventative medicine, actually. And so let me talk about the actual issues, like what creates chronic illness, for example. And I'm saying this to address the issue of perception. Because does it really matter how you perceive it, or can you just look at the basic facts that are before you and understand that this is not a matter of perception? It's imperative that you get serious about considering what leads to the main illnesses that we have today, which you're probably also facing. When we talk about an issue like stress, people just think it's just, an inconvenience at home. Stress is not just an inconvenience at home. Complementary medicine, it's not just about physical, it's not just psychological, it's also biological. So, for example, stress, which in most of our professions here, we see it as cortisol. Cortisol, stress hormone is cortisol. It's a hormone, okay? Now, this just dysregulates the HPA, hypothalamic pituitary adrenal axis. This is what, so when you're stressed, what that really means to us is that the stress hormone cortisol is dysregulating the HPA, your HPA axis. What that really means is that you're going to struggle to sleep, you're going to struggle with any kind of motivation, you're going to struggle with decision making, your diet is going to struggle, it's going to suppress your immune system. Let's begin there. If you're chronically stressed, your immune system is chronically compromised. That means if you're prone to name the illness, you're more likely to get it because your immune system is suppressed. It affects your cardiovascular system. It affects sleep cycles. It impacts your bone and muscle. This is just me addressing the perception that we have of seemingly small things like stress, but to say that they're not just psychological, they're actually biological. And so it is imperative for us to change our perspectives on health to a much more holistic point of view rather than to a limited biomedical point of view.
Thank you very much, Leona. And that's very, very insightful. I mean, thinking about it from a holistic point of view and being able to include these alternative options right from the start of treatment, and not just waiting for them to be just an addition. So in essence, she's saying we need to change, not only change our perception, but think of it as part of our day-to-day lives as we try and treat whatever it is we're treating, but also think of it as something that you can take on early enough before you actually get diagnosed with whatever it is the chronic illnesses are. Now we'll turn to, I would like to thank our panelists. We've had about clinical value, we've had about institutional adoption, patient empowerment. Would like to hear from someone from the audience to speak to probably the financial accessibility, probably someone from insurance. I see Brenda from UAP. Is there something that you could speak or say, add to this conversation? Okay. Can we have another mic go around? Just as you, before you speak, just introduce yourself, what you do, and go on to make your submission.
Yes. Good morning, everyone. Yes, my name is Regan Amoru Daniel. I'm a medical doctor with public health specialty training from the UK, and currently doing my Masters of Medicine, Internal Medicine at Macquarie University. So I completely resonate with what you said. In my time in the UK, working in the St. George's Hospital, complementary medicine is so huge in the UK, and I thought maybe, like she said, if you bring it back to Uganda, we see that especially for HIV people, because of the effective drugs, people are able to stay for long. So now this whole thing of talking about infectious diseases and all the things is completely off the list. So we're talking about non-communicable diseases. And recently, WHO has added mental health and other aspects to the whole conundrum of non-communicable diseases. So when we just stick to the biomedical aspect, I think we are missing a lot. So if we brought in aspects of mind-body therapies, mental health aspects, like you said, other aspects, I think holistically we should be able to help our patients. So I think these are very pertinent and helpful discussions, and we are really very grateful to be part of them. Thank you.
Thank you. Thank you very much. Brenda from UAP, just speak to the financial accessibility of complementary medicine. Thank you.
Good morning. By name Hunda. I'm glad to be here with you guys. Where we come in as insurance, we help you with the medical bills and everything.
Could we get the sound a little bit up?
Okay. Where we come in as insurance, we help with the medical bills, we got you sorted in time of when you need to access all this medical therapy, everything in hospital and all that. So we at your cover, at your service, in case you need us. I'm going to go around after the whole session of the conference to tell you more about it. I'll take your contacts and we'll talk more about that. Hopefully.
Thank you very much, Brenda. We have someone else over here. And then after the lady, we'll speak to Dennis. After Dennis, we'll have the other lady who will give us more information. Let's go.
Good morning. I'm happy to be here. Maybe for the insurance lady, just before it escaped my mind, complementary medicine is very limited in terms of insurance cover. And also there's an assumption that maybe they have some knowledge prior of what the needs are. But I think you can see the holistic team, how many people this patient needs at the start of treatment. So if you limit a patient to say therapy, I think it's very limiting. Huge cover allocated to these patients. So
Okay. Your name? We didn't get your name.
my name is, and I'm a physiotherapist.
Okay. Thank you so much, Barbara. That is to you, Brenda. She's noting that the insurance coverage is very limited. So, I don't think, personally, I think I haven't heard of any insurance cover that talks to mental health. So I think that is something that insurance companies need to look into. We'll have Dennis. Dennis is a fitness and health expert. I think he has something to add on.
Hi, good morning. My name is Dennis. I am a National Academy of Sports Medicine certified personal trainer, corrective exercise specialist, certified sports nutrition specialist as well, and I also do performance. I'm also a performance enhancement specialist. So basically, what I do is I turn athletes into machines. That's my job, part of it. Now, I have a similar background to Ishmael, yeah, and also this young man here. So my background is sports therapy. I'm also a personal trainer and so on. I've also worked in mental health in the UK. I worked for a year as a sports therapist in the NHS, in a mental health hospital. So I know the importance of having a multidisciplinary team, and all of this starting right at the beginning, and an effective care plan or recovery plan put in place for an individual. My philosophy when it comes to whether it's personal training or strength and conditioning is a very holistic approach. So looking at all areas of the individual, whether it's psychological, whether it's emotional, whether it's spiritual, and how all of these things integrate into helping the person make the quickest recovery, and not just that, but to also maintain where they are. But more than anything, especially in therapy, what we look at is root causes. So when somebody gets injured, you look at things like the mechanism of injury. How did this thing happen? What happened leading up to this? So that once the person has made a full recovery, you can put things in place to prevent them relapsing and things like that happening as well. I'll also touch on the differences between, I guess, what we call allopathic medicine. This is modern medicine, you know, drugs and this, that, and the other, and also holistic medicine. So allopathic medicine, like I think Ishmael touched on it as well, is about treating symptoms, but not treating the root cause. The first time I came back to Uganda after 23 years in the UK, this was 2013. Now, what I noticed was there was a lot of clinics, a lot of kind of traditional holistic clinics around, which have disappeared now. All right. I think one of the reasons that was because a lot of people could not afford the conventional medicine, so they will go into the traditional. Yeah, but I think what we need to do is go back to modern medicine is based on what used to be done traditionally. Okay, so all the drugs that you take now are all sourced from plants and traditional medicines, and they're synthesized and so on and so forth. But like I said, they only treat the root cause. I mean, they only treat the symptoms and not the root cause. Whereas traditional medicine will deal with the root cause to ensure that once somebody is treated, that they will not have a relapse. And I guess the unique thing about where we are in Uganda is it's not a disadvantage, it's actually an advantage. It means that it's a lot easier for us to integrate complementary medicine. I guess we're calling it complementary medicine, but I guess, you know, yeah, it's kind of holistic. It's easier for us to do that here, integrate that here into the traditional medicine right from the beginning. It's a lot easier here than it is in other developed countries, although what they're now finding in developed countries is they're now going back to the holistic route. They're finding that these things that they're finding that allopathic medicine is not really giving people the answers. People are having treatment, say for example, cancers and things like that. People are having radiotherapy, chemotherapy, and they're relapsing or it's not working long term. So they're finding that so people are taking their health into their own hands. They're going to health retreats. They're going to kind of traditional doctors and this, that, and the other. And a lot of people making recoveries. You know, some are, but some aren't. But I think it's about empowering individuals and giving them the knowledge and information to be able to make the decisions that they feel is right for them. And then I'll finish with this. When it comes to health insurance, I guess how health insurance works is this. The better health you're in the first place, the lower your premium is going to be. You know, so if you fill out the health insurance form and you have type 1 diabetes or you have this, you have that, then your health cover is going to be really high. So it's almost like they reward you for having good health to begin with if you're going to have medical insurance. And the onus, I guess, is on us taking our health into our own hands and not relying on, solely relying on doctors and medical professionals and things like that. And I guess the biggest challenge for the medical profession and other professions is educating individuals and giving them the knowledge, information, and the tools to be able to maintain or do the best with their health, so that when they do go to, say, a doctor, a physiotherapist, and so forth, that they are in a slightly better position, or that is able to take treatment is able to speed up the process. So thank you.
Thank you, Dennis. Thank you for that powerful information. He says, it's about time that we take our health into our own hands, and also the challenge now to each and everyone on this panel is to get that information out there for everyone to receive and understand how to approach their issues. Ismail had something to add on to that.
Just to add on what Dennis has been saying, so just to give you an example, we have a patient at the moment who's diagnosed with cancer, stomach cancer. And according to the convention medical, they decided that the only way to operate that is to take her intestine, 70% of her stomach. Okay? So she had, as the way, following on to Dennis's advice, you have to look around what's available. So she looked around. There was a place where they had to go to deal with the nutrition. So they tackled to treat the cancer through nutrition. So she was there for about 2 months. And because of the costs, and also because it was in a different country, she ended up coming back home because she was missing home. So when they did the test again, the cancer had reduced to 30%. So imagine if our patient decided to take that advice, number one, her stomach would have been reduced to 30%. 70% would have taken out. So I agree with you, Dennis, in terms of that. We need to start looking at the holistic approach, finding out the best, and that will help a lot.
Thank you, Ismail, for that addition. I think that's very important for us to note. We have another reaction from the audience.
Hello. It's actually from me. Hello, everyone. My name is Cindy. I'm actually one of the directors also of Activate Body Therapy. Just wanted to speak about the reason it's called the rise of and importance of complementary medicine. It should be called the rise and importance of holistic therapy. The reason why we actually called it that is there's still a lack of education to the meaning of those words. So we had to use these words that in general we felt were understood by a wider public. But for us, we do understand it is about being holistic and it is a mixture of therapies. But it just shows the level of education that we need to work together to educate people around us so that when we say holistic therapy, people understand what that actually means. So that's just to say, I think we're all don't agree with complementary medicine as a term, but it just shows that we felt we had to call it that just so that the wider audience would understand. But just that was just a small point.
Thank you for that point of information, Cindy. We had one more reaction. Your name and then you can state.
Good morning. My name is Aisha. I'm a nutritionist at AG Health and Nutrition. I'm happy to see that the panel already has a nutritionist on it. I'm also happy to hear that. I've been practicing in the field. I'm currently studying, but practicing at the same time. And I really feel like there is a little bit of resistance, especially in the field of the doctors, where most of the patients are reaching out to us, but because they fear that the doctor said no, then they actually don't take on the advice of the nutritionist. Because I actually had a patient who approached me and they had chronic urinolysis. Like the person is an adult and they are technically peeing on bed. They're not old, that they have a pelvic issue, but they're peeing on bed at the age of, like the person is a teenager. So this person reaches out to me and I told her, have you seen a psychologist? Because that automatically shows that their mental health is not okay. They probably have a lot of things they're struggling with. They're not talking to anyone about it because they're probably embarrassed about it. So they need a psychologist. So I told her, first thing you have to do, see a psychologist. Because this person comes to me and they're like, I'm tired of getting constant injections. I've tried to get surgery, but it feels like the problem is getting worse. My friends, I feel out of place when I'm with my friends. So what do I do? Then I looked at this person from the nutritional point of view. I tried to put myself in their shoes. So first we see the psychologist, and then we go on and start doing Kegel exercises. And you actually realize that in something like a month, that is 30 days, she had started controlling the pelvic muscles and she could actually not pee on, sometimes she would not pee on bed. So actually realized that what she didn't want, what she didn't need a lot were the injections. But most of her parents were telling her, like, do what the doctor is telling you. Go for your injections. Check your monthly reviews with the doctor. Don't tell me whatever it is you had. Just do what the doctor is saying. So we have that issue that people are so scared. Things like that. Eh? And it feels like we trust the doctors so much to the point that you actually look at a complementary method of clearing your health and it makes sense in your head. But because the doctor has said no, then you just trash the idea. Why does it have to be like that? And you find that this patient is actually doing okay. It has taken her a full year. I still do reviews with her. She doesn't pee on bed. But what she needed was not the injection, but actually a Kegel exercise and someone to really tell her that you're really worthy. You don't have to believe
that this is an issue you're going to last with till the day you die. So it took her the mental health classes and just a Kegel exercise, which is physiotherapy, right? A Kegel exercise is physiotherapy. That's what she needed to actually heal from that trauma. So these are really good topics. I have a lot of clients. I have clients who have asthma. Most of the doctors tell us you can't heal from asthma. Once you have it, that's the end of life. You're going to be bad. We have people who are exercising with asthma. We have people who are taking vitamin. Mr. Ivan, am I really lying that there are vitamins that can actually help with asthma? And yet people are taking vitamins for granted. And yet these are plant-based preparations that are made to help us fill in our nutritional gaps. Asthma is just we need to change the perspective of the people to really be open to the complementary side of exercising, like of healing, because it's really important. And I think that's basically the most difficult thing we are facing now, the bridge, trying to create that balancing act where you tell someone it's not a single approach, but it's a 360, where, yes, you have diabetes, check with your doctor, have your pressure checked out, let the doctor give you your medicine, but still go and exercise. Sleep on time. Don't stress yourself out. Do some Pilates, try and do yoga, meditate, and take that perspective from your head that I don't have diabetes. It's not there. Because actually believing that you don't have an illness can actually take it away. So the spiritual part of this whole thing is really important. And I'm so happy that we do have people who believe and stand for this cause. I'm just so happy that I'm here. Yeah, thank you so much.
Thank you. Thank you so much, Aisha. And I would like to, Peter has something to add onto that.
Yeah, thanks for that one. That experience is really great. In the UK specifically, what we do, and based on what you're saying, doctors should be respected, and we value almost the cornerstone of what they're doing. They take the lead from a medical standpoint. But in the UK, what we do, our approach is, and it's upon us clinicians, because we have a duty of care as professionals to sort of drive the idea that, if something's not right, we have to be the first people to call it out, regardless whether you're talking to a consultant, whether you're talking to a doctor. I think a lot of the times when a doctor says something and somebody finds a different alternative, and the alternative does work, there isn't a follow-up. Oh, you know what, doctor, I think, you suggested surgery. What was your understanding there, the patient has been able to do X, Y, Z, and they've got the results. Did you think, it's a discussion that you can have with these doctors, consultants, whoever it is. As we know, clinicians like studying, and you never stop learning within the healthcare system. You never, it's part of what we do. I think the follow-up is quite important, especially when you find that, in some cases, the surgical intervention was not the best intervention. The idea isn't then to scrutinize or, demoralize or whatever, but it's just to accept, maybe have those conversations with the doctor. Why did you feel this was the approach? Because it's a learning process. Even within those conversations, the doctor is also picking up something. As a result of that, if they're faced in the same situation with somebody completely different, it may trigger them to think in a different way, as opposed to saying, well, it worked, or you came to me and I fixed you, but you didn't have that chance as a clinician yourself to have a conversation with the doctor. So I think that's the difference that we have in the UK, in the sense that we have those discussions. No one's scared to speak to anybody in the healthcare system. All of us, regardless of what role you play, and you find that we get better results because we all have a duty of care. If I don't say anything that I found that wasn't really deemed appropriate, then I'm doing a disservice to the patients. I am, believe it or not. So it's within our rights to say, well, okay, didn't work. Let me follow up with the doctor. Why? Why did you feel like surgery was important? Why didn't we use this alternative? Because we got the same results. And I think also, again, what's important for us in the UK, we're guided by literature. So what does the study say? What is it saying now? What's the current literature saying? You know, and we use that upon ourselves to clinically reason the work that we're doing. So you find in some cases where, you know, therapy or physio, whatever it is, psychology, whatever it could be, is deemed appropriate. But we have to have that clinical reasoning as a cornerstone. It has to be there. You know, you can't sit there and say, because I'm a doctor and this is the patient's symptoms, this is what we're going to do. We have to have something back in what we're doing. And it holds you accountable and it quantifies what you're doing as a result. That is the only way you get better result as a result. If you're not, then, you know, we're just what we call winging it as we go along. You're just winging it as you're going along. And that's very, very dangerous. Yeah.
Thank you, Peter. And now back to you, Ismail, just to wrap up this session.
So just to add on from Peter's comments, before I moved, I used to work in UK, and I know the health system in UK, and I've been in Uganda for almost 10 years. So I'm able to talk about it both. So Peter's mentioned the UK. Let me start with the Uganda. I find Uganda should be able to work like UK, but there's a lot of divisions. Everyone tries to protect the corner. So when I moved to Uganda, my mentality was to work together, going back on what she said about 360 degrees. So that's what my concept. But then when I moved to Uganda, I find the physiotherapy protect the corner. Then you find the medical protect the corner. The nutritionist practice, the yoga, everyone, all the complementary medicine, including the medical care, they always work separate. And when you bring that idea, they say, yeah, we work together. Then eventually they take on. So you find out, for instance, hospitals, they're trying to do complementary medicine, but they're not skilled to do that. You know, in the end, they're ending up messing up a patient. I got a couple of patients that come back to me and say, I went to the hospital. This is what they did. Whereas we, as a complementary medicine, we always refer patients. We always say, go to the doctors, get the scan, see the writer, bring it back to us. Then we're able to treat. But in terms of Uganda, if you can adopt the UK spectrum of complementary, we work together. We should always look at patient as a patient. Our job is to make sure the patient is well looked after. From the minute they come in, how do we do? How do we make sure the condition doesn't come back? But I feel where the different departments protect, where you end up with the patient not being cured. So those symptoms keep coming back on because they're not referring. So I definitely think this conference is very good to highlight that. And if from this conference we can take on where we can form a partnership, work together. I always tell other departments, you shouldn't worry. Your patient will always come back to you, you know. So once you refer, they get looked after, then they come back to you and then you're able to deal with the patient. And also you get recognition.
Thank you very much, Ismail. And now, before we wrap up the session, I think we're here for this very reason, and that's why we have a multifaceted panel. But would like to also hear from Dr. Fowles because we need to understand exactly how the conventional medicine can, you know, step in all this. Thank you.
Thank you. I think, like one earlier presenter said, complementary is an indication of the journey, not only for the patients, but also for the clinicians themselves to integrate all these facets of care. With offering an example of what IHK is doing, is that each of my patients that is admitted on a daily will have a review by the physio team, will have a review by the nutrition team, and all of them at that point will assess and say, I don't have any work here, or I want to be recalled on day 2 and day 3, and this will be our plan. One of the rising partnerships has been between the orthopedic surgeons and the physio therapists, is that with them they work together. We've seen that bond come together. We've also seen that the internists, the physicians, and the nutrition team have started to gel a partnership because part of healing and recovery is also nutrition, but also to boost immune system. So there are quite a number of adjunct drugs that will be used in care, as well through antioxidation and all that is critical to healing. On a larger scale, again, now we need to ensure that that integration is done on a large scale. Quite a number of challenges have been faced in terms of number of physiotherapists in the country. You'll find that that number to the population is also very, very low, as well as nutrition, quite low. And people have not entirely also understood where to get these services from. And the linkage of care is broken from when I am discharged from the hospital to when I access my next services. What we agree upon at a larger scale is that these services are critical. And we have a huge job ahead of us to ensure that the integration is as smooth, because it's no longer about whether we need it, but it is a must as part of the combo. Thank you.
I think it's safe to say that we're all in agreement, and it's very important to note and hear from. Very important to hear from the medical doctor, Dr. Fawuz. Now, I would like to, before Ivan jumps in, we're going to seamlessly jump into our next session, which is going to mainly focus on the patient. Yeah, we're going to look at rehabilitation, we're going to look at nutrition, we're going to discuss mental health and how these aspects interlink within what we're referring to as complementary medicine. So, straight to you, Ivan, and Barbara, I'll come to you, right? Straight to you, Ivan, yeah? Nutrition is another critical factor. Yeah? And we just like you to share on how nutrition therapy complements mainstream medicine, particularly in preventing and reversing chronic illness. You give us your experience, but also speak to how that can help in preventing and reversing chronic illness.
All right, thank you very much. First of all, I want to thank very much Activate for organizing this conference and for all the panelists who are here and the audience as well. We've been able to hear a lot of wisdom from everybody, and we've already appreciated that actually we need to work holistically. All facets work together. Now, in my docket, which is nutrition, the part I want to highlight is that indeed, both actually work together. I've had the privilege of working, first of all, in conventional medicine as a clinical dietitian in a hospital. Yeah? So I can appreciate that sometimes the clients who come into a hospital need emergency services and need to be stabilized before they receive any other kind of care. For example, if somebody has a hypertensive crisis, I cannot help them in that state. The best thing I can do is help them get feeds through the tubes or prescribe the lifestyle after they've been stabilized. At that time, it's a medical intervention that's required for emergency services. Then thereafter, of course, I've gotten to appreciate integrative medicine, whereby you find that there are medical doctors in this country, and it's actually a growing trend where they appreciate the need for nutrition and other, or what we used to classify as alternative health services at the start of healthcare. So that has also been a phase. Now, I've come to appreciate what we have, the complementary that we are using for purposes of the audience, but is actually indeed holistic. And in this case, you find that there are other therapies, like the natural remedies I've heard you speaking about, some to do with nutrition, where food can be used as medicine. They can be helpful when it comes to someone's physical state. For example, if someone is already suffering from obesity, there's so much risk when it comes to physical activity or limitation to how much they can do. So they would have to first lose 10% of their body weight to reduce the weight on their joints and on their body at large. Now, in terms of complementary and nutrition, and in my experience in terms of chronic illness, I will give simple examples. The first example I'll give is this. Everybody who falls sick doesn't really want a very good doctor. what you want is to feel well. Not so. You don't want to have a very good surgery. Yeah? You don't want to have a very good medical doctor, a very good nutritionist. You want to feel better. However, we facilitate that feeling better, whereby you see the nutritionist, you see the physiotherapist, you see the medical doctor, mental therapist, and all that to get you feeling better. Now, when someone has a challenge like type 2 diabetes or hypertension, the thing they're dealing with is chronic. And the trend is usually someone first suffers from maybe, say, obesity. And back in the day, I would say maybe the medical field wasn't appreciating so much the dangers of obesity. And I've met clients who sometimes come to you and say they don't feel well, they can hardly, when they sit down, they can't stand up easily. And the doctor will do all the blood work. They're not feeling well, right? Do all the blood work, check them and say, I'm not feeling well, I'm not feeling well. Maybe they're not, the blood work comes out very well. Everything looks like it's good. But the obvious thing is that this person is actually overweight and they are obese. So that's the first challenge you would face. Now, when someone stays like that for a long time, eventually they develop other complications like high blood pressure. When high blood pressure comes in, you'll be given some medication, which you will take to, first of all, prevent you from having a heart attack, just to give you a lease on life. But that will take even up to a decade, but never reversing your condition. It will just keep you alive, keep you supported, not to have the challenge, but not necessarily high blood pressure. What comes in next will be, because of the medications you're on, sometimes other things.
So sorry, Ivan. I think that mic is breaking. Let me just hand you over this one.
Thank you. Yes, you have some metabolic challenges. Some of those would be a high blood sugar, whereby your insulin becomes more, your body becomes more tolerant to insulin, and thereby you have high sugar levels prevalently. When that happens, you may be added another regimen of medication. Not so? Maybe for another decade. However, with this medication continuing to pile up, your kidneys now have a bigger job to do. Now, you begin to have challenges with your kidney health, with your liver health. This process can continue until when someone eventually goes to be with the Lord. However, you can know that when someone actually has some complementary or holistic care, whereby they have nutrition support, whereby they have physical therapy, where they get exercise and do it safely, some of these challenges are actually reversed. I can say from my experience, you can actually have a regulated blood sugar to have a very normal or much better tolerance to sugar in about 3 weeks of diet therapy. Just 3 weeks. And yet, so many years of medication might not do that for you. So that's one benefit you'll see. I'm speaking from a point of experience because personally, at the age of 14, I lost my mom. And it was due to preventable causes that I knew about. Like now I know, but before I did not know. That actually, when someone has challenges to do with kidney, diabetes, maybe say cancer, or anything to do with heart challenges, high blood pressure, you need to have care from a nutritionist, because if your medical doctor is not going to give you nutrition advice, and you cannot blame them for that. For example, the person is a medical doctor or a surgeon. They have trained in medicine, yes? So they give you medicine for an ailment, and they give you surgery for an ailment. But for chronic disease, you might need nutrition therapy, mental therapy. I'll give you an example. The person was told, you can eat matoke, it's just water, you know? Maybe you can stop, don't eat this, don't eat that, reduce salt, something like that. But the diet advice is not, can I say, comprehensive enough to support a patient to recover. In cases like, for example, that person's mental state has to be taken into account. How they're feeling mentally. Are they actually up to do this meal plan you're talking about? Can they start with eliminate this immediately? Or can you phase it out slowly by slowly to get the result? So you can find a lot of success let's say in about 2 months, to have better blood pressure results. That will be if someone actually adheres to the regimen they're given. For example, for high blood pressure, you will know that even if I give you a very good diet, the most you will do is lose weight, but your blood pressure readings might not change immediately. Research will show, the doctor will maybe back it up for me as well with his experience, and also in my experience, I've noticed that for every kilogram of weight you lose, you will have 1.5 millimeters of mercury lost on your diastolic blood pressure, systolic, and then you have the 1 milligram of mercury on your diastolic blood pressure reducing. So losing 10% of your body weight can help you better off regulate your blood pressure. That's one benefit you see in chronic disease. The second one, I already mentioned the one for blood sugar, whereby just by changing someone's diet to have regulated carbohydrates to make them those that are richer, whole, real and unprocessed, and then giving them a plenty of vegetables, you find that it will create a regular diet for them that is healthy, that will help them with reducing their insulin doses and sometimes even their oral doses, the oral medication they're on. For every medication you take as a chronic patient, they are what we call risk factors or risk deficiencies you're going to get. For example, if you're a person who takes metformin, it will be associated with lower vitamin B in your system. So if you do not get either necessary supplementation or the dietary guidance that you need at the start of your medical regimen, the medication might work against you in some cases. You've had the medical doctor mentioning some medication has nutrient and drug interactions. You say, don't take this medicine with milk, maybe takes after food. Don't combine this type of fruit with this type of medicine. For example, you can't combine grapefruit with wine, or let's say with medicine for your heart, for heart health. It could actually make the effect much more amplified. I don't want to speak so much. I know I have limited time, but I wanted to highlight that in actual sense, when you meet a holistic therapy at the start of your care plan, your outcomes are much better, much more sustainable, and you can be able to recover in the long term. So I have personally seen those testimonials. I want to thank very much Activate for involving the nutrition team in this in their care process. So they do a very holistic approach. And I also want to appreciate everybody who is here today to support the holistic approach to well-being. Thank you.
Thank you very much, Ivan. We've heard about nutrition, and we'll have moments to network and get more information, get to know about each other. And now I want to direct my next question to Leona. We've heard about nutrition. We've heard from Ivan, and we know that mental health often intersects with physical recovery. Yeah. So we want to hear from you and understand, how do therapies such as yoga, mindfulness, and physiotherapy support mental health recovery?
All right, thank you. For one, I'm just going to use a blanket, a general statement. Let's call it mindfulness, right? So first, it reduces stress reactivity, which reduces, when I say stress, I mean it decreases cortisol levels. Again, cortisol is a stress hormone that affects your higher brain centers, your cardiovascular system, your immune system, your muscular system, everything. And so these practices that you've mentioned actually help to reduce that. Also, it enhances emotional regulation. I think a thing that we take for granted is emotional regulation. Just calm responses to distress. Many of us are much more reactive than we're responsive. You know, we lack regulation, and in the talk that we have later, maybe when we're talking about solutions, my answer has a lot to do with emotional regulation, because these are not things that we are conditioned to have, especially in the African context. You know, we're taught many things, but not so much how to regulate ourselves. So how is a teenager in boarding school that is experiencing a dolo, as we know it, how is he regulating himself? How is he holding back from the things that he's craving and pulling him? How is he holding back from basic things like having a crush, like fear, like anxiety? How is he regulating himself? What happens when his neighbor offers him a gummy that has marijuana and costs 500 shillings? He finds relief. It soothes him. And that begins the journey of addiction and dependence. It decreases rumination. Rumination is repetitive negative thinking. Again, it sounds very surface and small in the grand scale of things, but actually that is how cortisol increases. And if we can really think about how effective stress hormones are, even immediately, stress is fight and flight. It was now increased to fight, freeze, or flight. It really means, and we need that hormone, because why it's there is that no matter how tired you are, maybe you've spent a whole day running marathons and doing things, no matter how exhausted you are, if you see a snake right there crawling towards you, what happens is your stress, your fight and flight, fight, freeze, or flight mode kicks in. And then you either fight the snake, or you freeze, or you flight, you run. That's what it's for. Okay? It's useful. Now, the problem with it is that the brain doesn't really know the difference between a snake approaching and a deadline and a stressful partner and, you know, all kinds of things that you've been conditioned, or the environment that you live in and the stressors that it holds. It doesn't. So if you don't know how to regulate yourself, your brain thinks lions are attacking you and is putting your entire system into that fight and flight mode, which means it's activating, it's removing resources from where they are needed and putting them where you need to fight or flight chronically. That means your immune system is chronically compromised. Your higher brain centers is chronically compromised. You're starting to forget small things all the time. You struggle to concentrate. You don't have mental clarity. You don't have. This is where this complementary medicine we're talking about here comes in. It helps with self-awareness as well, okay? Which helps to reduce denial and helps conventional medicine, because a lot of people are in denial, including myself. I've been meaning to come to do to do some health tests, but you know, denial is not really a solution. If you have cancer or if you have any affliction, it's prudent that you go and find out if you do or not. Not finding out does not remove it. Okay? So self-awareness, it helps with resilience. You know, I think we can all agree that there is a small crisis right now with resilience. You know, everybody's the prize. It's let me not dwell. Let me not go there. Sleep quality. It helps with sleep quality. Yoga, mindfulness, physio. This helps with sleep quality, and I think that people really underestimate the value of sleep. But sleep is restorative, you know, to your body. The thing is, the human body is able to heal pretty much anything, just given the right environment. So what is the right environment? Okay, so sleep serves, for example, the liver. The liver has purposes as it detoxifies the body. Is what it does during the day and what it focuses on during the night. Okay, so for example, there's an increase of actively in the metabolic states. That's when you're sleeping. That's when the liver concentrates on that. Okay, in the metabolic cleanup tasks, like for example, your immune function. Okay, so if people, I've seen people who say, I'm perfectly fine on 3 hours of sleep. No, you're not. That's not factual. You know, you need to get into REM sleep. That's 1 to 3 hours of sleep for your body to even start activating these functions. Okay, but we glorify insomnia. You know, it's a cool thing to be an insomniac. That comes from a point of, I think, maybe ignorance, maybe not knowing what sleep is actually for. And so there's so many purposes for that, but those are the ones I can highlight immediately. Yeah, thank you.
Thank you so much, Leona. She speaks about um, all these therapies being able to help you with self-awareness, being able to regulate your emotions, being able to reduce the negative rumination. And now we're going to get back to, thank you so much, Leona, for that. We'll bring this back to the hospital leadership, yeah? Dr. Fouz, how can medical, and this is something that we've been, I think, going back and forth with in the previous session, but would like to understand that how can medical leaders practically integrate these complementary therapies or practices into treatment plans? I'm talking about physiotherapy, I'm talking about nutrition, I'm talking about wellness coaching, mental health. Just give us a little, throw more light on that. And yeah.
No, thank you. I think this is being done already, albeit on a smaller scale. And part of the discussions today is how do we enhance those discussions across the various complementary services that we have. One of the key is that at C-Care, we have started a wellness program, and we have doctors who have set out to specifically have the expertise around wellness. And I like to stage health or the disease process across maybe four aspects. That today I'm normal, and then I live a risky life. Then I'm pre a disease state, and still I do not walk to the hospital. And then I have disease, and then I'm treated for the disease, and then I go for rehabilitation. Now, what is critical is how do we keep the normal people normal? How do we keep the pre-disease stage people back to normal? And then how do we comprehensively manage those with disease through the rehabilitation process? We've seen that our chronic care disease burden has gone high. We have a more sedentary lifestyle, and our disease profile is now starting to get closer to Peter's population in the UK because of how we feed, because of how we behave in our day-to-day. Sometimes I joke and say that the borders have caused more harm. Peter walks from one train station to another, and for us, at the immediate exit, you take the border to the next. Very helpful with transport, but we walk less, we exercise less, because these are routines that we have in our day-to-day that basically will help us. And I challenge us that the team that is online and here, when did we last have a wellness check? How many of you know your sickle cell status? Because it's also apparently the sickle cell month. How many of you know what your blood sugar is before you eat, when you eat? How many of you know your fasting time? How long can I spend without eating? And these are critical thought processes and conversations of a person who really wants to be healthy. Same again as the patients struggle to find a specialist for what they need. Quite a number of times with my migraine, I've ended up from the neurology clinic to the ENT, and I am a doctor myself, and I don't know that I needed the ENT. So how does a patient at home know that with this kind of problem, this is the person I'm going to go to. This is where I need to assess. Again, speaking to Leona's presentation around mental health, is quite a number of the patients as well are not sick, but they are shy to embrace the real challenges that they have in their day-to-day life. I measure my sleep hours every day. I measure my meat intake every week. I do all these things. But how many of us are able to keep up with that? Maybe the joint pains are because of my meat intake. Maybe the body pains are because I sleep less. And the underlying root cause, as we've been discussing through, has not been tackled. How often, or have we ever had audience with a psychologist, with a mental health practitioner, even when fine? Say, I'm here, and this is my routine. I don't think I have a problem, and we discuss through it. So these are activities that we need to normalize as we integrate them into care, to ensure that we cover the facets of life that will make us healthy. Thank you.
Thank you very much, Dr. Fawz. I think it's very important to note that he talks about breaking those routines that we have adapted to as a country, but also Ivan earlier mentioned the link that is represented from ABT Clinic, and how ABT Clinic refers some of their patients to Amicable for nutrition advice, but also Dr. Fawz mentions that at C-Care, they have wellness program that's already in there. So I think this is something to note, that the complementary all these alternatives are being now integrated. But the problem there now is it's at a small scale. And it's important for us to also engage in the conversation of how do we spread this across the entire population, and not just to a specific percentage of the population. Now, we're going to have a Q&A session right after the session, but I want to engage the panelists a bit more on focusing on the patient. And before we get to you, Ivan, I'd like Ismail to get us more. He spoke about pain management earlier. Ismail, you spoke about pain management, and would like to know how you expand on how holistic rehabilitation prevents relapse and improves long-term outcomes for patients.
Just to answer that question, I'd like to start with, I'm a great believer of prevention is better than cure. So we have to look at what causes pain, what causes all this, what Ivan, Doctor, they've been mentioning. It boils down to, me personally, I think is nutrition, okay? If you look at average Ugandan person, the level of exercise they do, the food they eat, the rest, okay? So there's a lot of people are not doing exercise, they're not eating healthy, and they're not resting. As simple as that. Because of that, you're going to have an implication of pain. And why does that happen? Most people are going to gain weight because they're not doing exercise. So because of the weight, it's going to develop pain. That pain can either be acute or chronic. It can be acute stages, which is early. It can be prevented. Or if it's not prevented, it becomes chronic illness, as simple as that. So if all of us are able to prevent that, it will be a lot better. But we can prevent that through exercise, eating healthy, and resting. However, if we don't, of course, you're going to develop pain. And in terms of pain, we're going to have a lot of injuries. We're going to have illnesses. And I would like to highlight at Activate Body Therapy, how do we deal with a holistic rehabilitation? So in terms of holistic rehabilitation, assume you have developed pain. You haven't been doing exercise. You haven't been eating healthy. So one of the things we do, we believe in complementary and also convention. We will make sure that all your checks are done up to date. we'll send you to a doctor. We'll make sure we have scans. Assume everything is okay, and the doctor and all the therapists, all the practitioners are okay. Then what we will do, we'll treat. We'll start treating. I would like to give you an example. If someone has a grade 2 tendon tear, which is tendinosis, how do you deal with that? At Activate, the first phase we'll do is about reline, it's about soft tissue release. Then from there, we start doing mobility work. Once we gain mobility, then we start strengthening. So we start strengthening the Achilles. So from there, once the strength training is achieved, the person is stronger, is pain-free, then we encourage you to do maintenance. It doesn't stop there. A lot of people, when they come in and they no longer feel pain, they go back to their normal jobs. However, the rehabilitation or the holistic rehabilitation must continue. The same way you go to work, the same way you eat every day, this is just part of your routine. So a lot of people get confused. What can they do on the maintenance? So at the beginning, we had a clinic. And every time we fixed or repaired anyone who had pain, we told them, now you can go to the gym. You can start living a healthy lifestyle. We found those people didn't know where to go. So the reason why we open up a health club to continue, so that people continue. So we have specialists to continue keep looking after you. So we give you exercise, the nutritionist there, we work with partners. So we believe, even when people come to me, I completely tell them I'm not a nutritionist. I'm a nutritional advisor, so I always refer to someone who's better than me. So that's how we do at Activate. So we continue. We believe holistic rehabilitation must continue. A lot of people think just because I have injury, then once my injury goes, then that's it. That's not the end of the road. If you don't, the injury or something else might happen. Take an example. Most people that have pain on a shoulder, let's say the right shoulder, once the right shoulder is fixed, there's more likely chances that the left side will go because you've been compensating. So most of the time when you're injured on the right, your case is all your body weight or everything, you compensate with the left. So once the right heals, the left side will go. So I Activate again, we take time to make sure we balance out the body and make sure we achieve the holistic approach.
Thank you very much, Ismail. We have heard from him. Holistic rehabilitation needs to be taken very seriously and needs to be continued. It's a continuation. It doesn't stop, and that in retrospect or hindsight, we see that prevents relapse and improves long-term outcomes of for patients. Now, I'm going to direct my next question to Peter because there's a relation there. Peter, very experienced in sports rehabilitation. We know that the goal isn't just recovery, but also prevention for you and also peak performance, right? So how can these approaches like prevention, like Ismail talked about, conditioning and long-term care be integrated into complementary medicine to improve overall patient wellness?
It's, it's quite different for me. Through my experience, a lot of the patients I do get are medically stable. So we carry out an extensive assessment, so both subjective and objective. So understanding the past medical history, the health of the patient. In my field specifically, I'm working with a lot of high-end, elite, high-performing clients. So the expectations are they want to get back to playing as quickly as they can. What we then tend to find is, through those assessments we carry out, looking at your biomechanics, looking at the previous injuries, even the sport they engage in is sort of gives us an idea of what treatment would be beneficial for them. Specifically looking at complementary, so stuff like massage, mobilizations, manipulations, again, depending on the patient. So if somebody's coming in and they've had an injury, if it's a tendon tear or, a recurring injury, so they keep having the same injury, hamstring or, a foot and ankle joint injury, we understand, so we break down the patient, starting from obviously the history. Once we've gathered that information and we know how the injury happened, we then break down and look at their biomechanics, the type of injury, the phase where they are. Is it acute? You know, how long has it happened? Are we into that medium range phase, or is it becoming chronic? And even just understanding their day-to-day, their 24-hour, plan pattern. How do they associate themselves with this injury? You know, how do they associate themselves with the pain that they experience, the discomfort? A lot of the times you find, and an MDT approach, not really going specifically into depth, like the psychology and the role that they play is quite integral, because you can pick up some of those skills and you're not really claiming to be a psychologist, but understanding human behavior, like someone would be guarding that area, as Ishmael mentioned. You as a clinician would then dissect that and understand and teach them that, by the way, if you continue walking the way you're walking, or if you don't put in enough pressure through that leg, the likelihood is you're going to really cause more damage. So once we understand and sort of break the biomechanics, we then look at, okay, what's appropriate in terms of exercise or intervention. It could be, doing, exercises in the gym. It could be a combination of manipulations, mobilizations, as well as soft tissue, to aid whatever we're doing in the gym. We tend to find that we get better results by building rapport. I think that's not something that we've touched on in this discussion. Building a relationship with your clients or your patients is so important. They have to believe, that what we're doing is going to work. It's effective. A lot of the times, my clients will come to me, and they've been to multiple people, and they don't know what's going on. I have pain here. I don't know why I have this pain. But understanding that person and really trying to not take on everybody as the same, and being able to adjust with everybody is quite important, because you need them to buy into what you're trying to tell them. You need that, or else you won't get the results. That's a given. I mean, once we do that as well, then it's easier for us to go through that rehab process and into the end. So we're looking at aftercare, and a few of my colleagues here have mentioned that the aftercare is an issue in this country. Again, education. So really, I take time in trying to teach the patient what you have, what kind of injury you have, what kind of injury you have, what happens, how long are you going to be in pain, or how long are you going to have this discomfort? Because more they know, able to the process and engage in the process. As I say to all my clients, a lot of the times is, this is a collaboration. We're collaborating together. This is not, I am, I'm in charge, or I tell you what to do and you do it. It's a discussion, and you have to help me help you. So in terms of like aftercare, throughout that process, the aftercare is then easy for me to then the aftercare discussions are quite easy, because throughout the whole process, we've been able to sort of, patient educate, so educate them about their lifestyle, education around what they feel and what does that mean. Again, education around, interventions to prevent you from having these issues. So when we talk about the aftercare at the end of the rehab process, it's mainly looking at just continuing doing what you're doing. Without you doing this, ultimately, you're going to come back to square one. So continue. Can we continue the habits that you've picked up throughout this process? Do you understand your body a little bit better than you did when you first walked in here? Because that's also important, because they may have another issue and I'm not able to help them. So these are skills that we tend to reinforce throughout the process. And ideally, to be fair, like the approach that I have in terms of, therapy or rehab, or whatever it is we don't want you to be a returning customer. We want to help you so you can pick up the skills to then go off and understand, and you'll be able to help yourself in a sense. So if it's, I want to lose weight, or I want to get faster, I want to get stronger, whatever it is, we install those skills from an early stage to then help you. I've also had some experience in working in a neuro rehabilitation hospital in a private sector, which is a bit different. And this is where I started picking up these skills in terms of, systematically building, putting things in place, so having time frames as opposed to, taking everybody for what they are initially. So those time frames allow you to sort of not only quantify what you're doing, but at the same time allow you to then, have those discussions. So, for example, 6 weeks after you've come in, we can sit down and have a conversation. What is it you're learning? How do you feel? Why do you feel the way you feel? And what plan can we have moving forward? What we call like SMART goals as a result. So implementary therapy is quite important. And then I think, having discussions with other medical team, other clinicians is quite important because you're able to then relay some skills. So you may not be a doctor, you may not be a psychologist, but you may understand, for example, if somebody is really, guarding and really overprotective or stressed, as you've mentioned, that's definitely going to impact how they come to you and how they perform and how they recover. And, even if it's a dietitian, in terms of their lifestyle, if somebody smokes, we know and understand that will definitely affect the healing process. But the more we know through these discussions that we're having here, the better it is for all of us individually within our scope of practice, because we're able to pick up bits to then have, as opposed to, sitting there and not knowing what you're doing initially as a result. So I find that complementary or holistic approach has been very effective. But again, within my scope of practice, which is specifically this sport, massage, soft tissue, and manipulations, those are the areas that I really focus on within the patients of my classification as a result.
Thank you very much,
Thank you.
Peter. We now know that these approaches can definitely be integrated in complementary medicine, but also know that it's a step-by-step process. So, ladies and gentlemen, just know that prevention is better than cure, as the earlier speakers have mentioned. And now, before we get into the audience, would like to hear from Ivan. Ivan had something to say, and then we'll get into the Q&A. I know we have a couple of doctors in the audience, and would like to hear more of them, especially about focusing on the patient around rehabilitation, mental health, and nutrition. Ivan?
Thank you very much. What I wanted to supplement to what the pre-current speakers have mentioned is that innovation is very important when it comes to a holistic approach. I want to first of all appreciate C-Care and Activate and all the others all over the country that are incorporating nutrition in their care plan. I've also want to acknowledge that there are some people, like I know Activate has Usawa, which actually provides food, not so, actual food. So that's a really good thing that I want to appreciate. That nowadays, yes, we might give them knowledge, yes, we might give them treatment and care, but at times about the lifestyle change and certain things like where to find a healthy meal when you need it is very key to someone who's recovering from whatever it is they're dealing with. Sometimes at home, it might not be easy for your people to understand what to prepare for you in the first month, the first week, or the first day. So besides the nutritionist giving you advice, sometimes places that give you food, I know we do that at Amicable, but I know Osawa also does that, and any other healthy restaurant around the country, it supports the outcome to come out much better and be more sustainable. That's one thing. The second thing I wanted to highlight is about insurance. Lately, you find that, yes, because of the mainstream medical care from hospitals, sometimes nutrition services are catered for. But it's very rare to find that nutrition, maybe across the board, that these complementary services like mental health or nutrition are not necessarily catered for when it comes to insurance. So people have to appreciate them individually and then pay for an extra service on top of the medical care. So that might also slow down the absorption of this holistic approach. If someone knows that my workplace is going to cover my insurance, so they would want to go to where the insurance is going to be covered. They won't necessarily come to a gym and work out. They won't do other therapeutic services that are very important to their care process. The last thing I want to highlight is that in terms of this care process for the individuals, yes, people are taking it up individually and paying for these services individually. However, I would like to make a push. Maybe this is not to preempt your next discussion about policy. I would like to preempt it. That actually the insurance companies actually adopt all types of complementary well-being. Physiotherapy, mental well-being, sports therapy. So such would be prevention, which is better than cure, like Ishmael mentioned earlier on. That's what I wanted to contribute at this stage. And thank you very much.
Thank you very much, Ivan. We'll now get into the audience. We'd like to hear from a couple of doctors. And I'm aware that we have some clients to activate body therapy, both the health club and the clinic. Would like also to hear from you. If you have any questions, please bring them forward. But over to you, the audience.
Good afternoon. Am I being heard? Yes, my name is Dr. Jamina Nabukera. I work with C-Care and other hospitals. Yes, currently also a resident in surgery. So I think physiotherapy would be part of my goal of care for any patient. So I'm glad to be here. I have a couple of questions. I did not get to be a part of the first few hours, but at least the first few minutes were also educative. So my first question is for me and also for my patients. They're always asking like, what's enough exercise? These days we are very, very busy, and we've all heard that exercise is very vital for our health. So if I just take a walk of 1 hour every Saturday, is that enough to help? So if I have that question in the exam room, what can I tell the patient? Then the second would be, patients are always asking about supplements. I don't know if we touched that in the nutrition, and which supplements are safe. Do we have enough research to actually tell them about these things? Because as doctors, we are in training. It's always a taboo. Like, what do you mean supplements? So we need to actually have knowledge out there for the doctors and for the patients as well. And that being said, like he was talking about insurance. Insurance doesn't cover some of these things. So if we are to take part in implementing some policies, if it's something important, I think insurance should also start looking into covering these things, because it's as if it's meaning they are not important. Part of the things insurance should also maybe consider covering. If a patient comes to you and you're treating so many other things, but part of the diseases they have is maybe alcohol use disorder, and this is something you can't even include on their form, otherwise they won't be covered. That means I'm not treating this patient holistically. So yeah, there are so many gaps that need to be filled. Let's not shame alcohol. Rehab is part of care. So I don't know if insurance packages are there that cover that. Then I was last in medical school a few years back, but I think if we have policymakers or we're in touch with them, these are topics we need to start implementing in our curriculums. Because I think in medical school, we only touch a bit of mental health, a bit of that and that until you go and specialize in it maybe. So I think where we are going, it's becoming really important and part of health. So I think also that doctors need more knowledge on it. Yeah, thank you. Those are my supplements and questions.
Thank you so much. I think we'll have 3 more questions or 5, then we'll have some responses. Thank you.
Thank you. My name is David Mayanja. I'm a client of ABT. Mine is not a question. It's just testimony. Testimony means that I had a years. I had been to several doctors until eventually somebody directed me to ABT. I had an authentic pain in the neck. You know the expression, someone can be troublesome and someone says you're a pain in the neck. Mine was authentic pain in the neck. Insomnia, no sleeping, I cannot sit on plastic chairs. I walked into ABT and the gentleman over there attended to me. I think he gave me about 10 sessions. I went through about 4 of them, and I can tell you the results were tremendous. Up to today, okay, I have recovered tremendously. I sleep well, and, all my gratitude to him. No medication. I'm really grateful. Just a testimony. Thank you.
Thank you. Thank you so much, Benjamin.
Thank you. Mine is also a testimony. My name is Peter. It's about ABT. So I think around September 2024, I walked in. I couldn't walk. I was actually using a walking stick. When I was flying out, use a wheelchair. I went on to a 5-month program, and I'm now much better. Okay? And that's all thanks to ABT. No medication, just like the gentleman who just spoke said, but it was just all through physical therapy and exercises. I would also want to say exercises are very key for everybody. At least you need to do 3 days a day and ensure you do some exercises. Thank you.
Just a question for you, Peter. Are you still using the walking stick?
Nope. I think you saw me walking in. I'm all fine.
All right. Thank you. Thank you. Thanks to ABT. We'll have Barbara. We'll have you, then we'll have Barbara, and then the gentleman over there and the lady from Amicable.
Yeah, thank you so much once again. I think for me, this session has been very, very exciting because complementary medicine is really bringing the whole approach, because we as doctors, most times we tend to focus on the pathology and leave out all the other 360-degree aspects of patients. So for me, this is wonderful. So I wanted to ask Peter and the gentleman with the UK and the Ugandan perspective. I mean, I might be preempting the next discussion, but mine is on being a public health professional myself and also a medical doctor. I think that the huge gap we have is policy. Peter, you must be knowing this. In the UK, I think they have clear-cut policy frameworks whereby they have integrated these complementary medicine aspects to the conventional. So I'm just wondering, what can we borrow from the UK, especially to you, in order to sort of like integrate such aspects to Uganda? Of course, not forgetting the other things of regulations, because anyone can just maybe think the complementary medicine expert, mental health expert, and all that. So how do we sort of like create that balance of regulation and all those aspects? Thank you very much.
Thank you. We'll have the responses right after. Let's just run through it. 2 more, then.
Thank you. I have a few questions. So Ivan mentioned something about adherence. I have challenges with adherence, and we tend to throw it out there that, the patient is not adhering, so I'm finding challenges. So all the disciplines here, what do you employ? Like what other practitioners, how do we make them adhere to all these complementary? Because it's quite large. Burnout, trying all these therapies. So how do we adhere to these treatments? Then my other assessment, I know that CT to assessment, yeah? So, but in facilities that are limited, the scope of Ugandan practice, yeah? Maybe the proprietor may not be able to employ all. So if I met a a policy maker right now, what should I push for? If I happen to land on someone that can make an instant change, what should it be better that when a patient walks into ABT, that maybe that they should at least meet 3-4 of these disciplines, or should we keep the referral system that takes us around circles, like results? Yeah, those are my questions.
Thank you, Barbara. We had the gentleman over there.
Thank you. I'm Dr. Paul Sekate, an emergency medicine resident in my final year. So I'm really happy with today's talk. It's an amazing one. But to back up whatever is being said here, I think it's important that we start having research being done on this type of care, because it's what we base on data as we are formulating policies. You cannot base on words. You need that data to be displayed in order to formulate a policy backed by that information. Secondly, for most of our patients, we are talking about curative therapy. It's important that we look at the prevention arm, and this goes to insurance. Most of the time, I do not see insurance covering wellness checks. They come in to cover the curative side. So we need to look at the wellness side, because, for example, the dietitian is very important if we do cover the preventive arm. That's, let's say someone is in a pre-diabetic phase, someone is in a pre-hypertensive phase. That's a very important phase. Other than waiting, the person is hypertensive and then they come in. So I would request insurance to take care of that, because it's a very important. But the most important thing, we request that you capture your data. It will back us up. Then secondly, do the case reports. Let's have the case reports come out, let them be published so that we can read them and have evidence to back up everything being done. Thank you.
Thank you very much. Point of information there. Publish your information. That goes out to the specialists on the panel and everyone out there in the audience. Insurance, if we have anyone apart from UAP, you also have some information to take back. Now we'll get into the responses. We had a question from, we have another reaction.
Thank you so much. Good afternoon. So I am Lynn Ednans. I am not by profession part of the medical sector. I am a lawyer, but I'm a wellness enthusiast. And that is how I associate with the Amicable Nutritionist. So since there was a bit of a trend of testimonies, I'll start by sharing mine as well. I think from the time I was a child, I was just a skinny girl, you know, and it used to be a joke that would fly around. But when I grew up, I realized, no, this can't be, because people would be like, oh, she's just a bag of bones, because I was really tiny. And I didn't believe in wellness. I didn't believe in nutrition. I didn't think it was a solution to the challenge I had of failing to gain weight. Making matters worse, my dad is a medical doctor for wellness. So when I got about Ivan, and when I inquired from my, that's a waste of time and it will not work. But to my surprise, I moved from being 45 kilos as an adult, you can imagine, and I am now 65. So that is a testimony. And then I deal a lot with the young people. So to say, I work a lot with communities that have youth. And I have come to understand, even from my own example, that there is a lot of misinformation out there or ignorance. So in school, we are taught about things like balanced diets, but then
practically, I've come to understand that is not what is required for someone to have a very nourishing body. And then we have other misconceptions such as mental health, a foreign concept. And mine is a question, I think, to all the panelists on how best do we join hands, even with people that do work such as what I do in terms of youth advocacy, to ensure that the children, right from primary school to secondary to the university level, are getting the right information. And I feel like it speaks a lot to the education sector. What are we teaching the children in school? And when it comes to concerns like mental health, how sure are we that the teachers themselves can identify when a student or pupil is actually having a mental health challenge? Or do they just dismiss it as someone being very problematic or into themselves or an introvert and those different things? Shown in terms of how best can we work together to see to it that we create a system and an atmosphere where these things such as nutrition and wellness or complementary medicine and mental health are not just looked at as foreign concepts, but things that everyone understands. And there's a lot of great knowledge that has been shared by the panelists, and I think we should find a way to ensure that everything that has been shared gets to the youth, gets to the young people, because we do not want to have a bridge in the generation where the middle-aged people, so to say, understand, but the youngins are totally blank about these things. And maybe the last thing I would say would be, from what has been shared, I pick that there is a need to collaborate. You know, so many people say as one you can only move so far, but when you're many, there is so much more that can be done together. So I think after this, maybe one of our action points should be, how do we get these different sectors to sit down and have, say, a paper? It could be in terms of a policy or just a working document of how we are going to work together to ensure that we each understand one another and how we can work together. Thank you.
Thank you so much, Lynn. In terms of policy, we'll be tackling that in the next session. I'm afraid that we're going to cut this a little bit short in terms of the responses, but those that were highlighted, I think the panelists took note of them. We had a response. We had a reaction on supplements. I think Ivan will be in the best position to respond to that. Maybe also Dr. Fawuz will jump in. We had something on insurance. We had a little bit on adherence and assessment, and anything on policy. We're going to discuss it in the next session. But let's have responses to those questions and maybe a few clarifications. Then we can get on to the next session. Thank you. We'll start with you, Ivan.
Okay, thank you very much. I'll get right into it. The first question has to do with supplements and their safety. My 2 cents on that will be, if you are to supplement, first of all, make sure whoever is giving you that supplement is well aware of the possible side effects, the correct dosages, and when they are necessary to be given to somebody. That's the first thing, so expertise. But in an ideal world, you would not need supplements. You would be living a healthy life, eating a healthy diet, exercising, sleeping well, maybe having your mental health in check. However, because of the so many stressors in life, whereby we've heard about people being very sedentary, some people are already sick. And because they're sick, they already have certain deficiencies they are prone to. There are others who are very stressed out and they don't even realize it. But she's mentioned a lot of the science to do with stress. But one thing I will highlight is that if you're very stressed out, your vitamin B will be depleted much faster. So you find that just some small lifestyle things like those would need some supplementation. That's to do with supplementation. And in terms of safety, there are many that are on the market. The NDA does its part. And also we have other associations that deal with natural remedies for those, because in complementary medicine, you can't talk about it without mentioning maybe some herbs or spices or something to do with a natural remedy that's to do with a powder or a capsule. So those are also well regulated in this country, but also look for an expert who understands both the integrated, let's say conventional, and also to do with natural remedies. It will be the best solution for you. Then in terms of, let's say there was a question about adherence, right? I hope I haven't missed another question there, but there's one to do with adherence. My 2 cents on adherence would be, first of all, I will side with Peter. He mentioned about relationship building. It's one of the most important things when you're doing a holistic approach. The person you're dealing with is a human being and not a robot or a test subject. Meaning that if they walk in, they don't want to get a very nice PDF or a very nice, workout regimen. They want to feel understood, listened to, and to feel that you understand them beyond their current health status. That's what will, first of all, build their interest in following your health regimen. So relationship building. Maybe just to digress a little bit, I would say the reason why we're called the amicable nutritionist is because we noticed that many nutritionists were quite harsh when it came to people's care process. So we want to be a bit more non-judgmental, not very harsh on somebody. You want to take care of someone's health while taking into account their mental well-being. You don't want to give someone a diet plan just because they're struggling with weight, and then it makes them get depressed or make them spiral into worse health issues. That's to do with adherence, one. Then the second thing with adherence would be that you'd have to innovate, make solutions. I've mentioned that nowadays we have some restaurants or health centers that actually provide food. That's very key. Sometimes it's about the environment someone is in. They've been growing up for a long time. There's low demand for healthy food. So finding a healthy meal for an average corporate Ugandan might be a bit of a tall order. So giving such solutions would make it easy as well. The third thing you want to do is make it as simple as possible. Simplify it. I know we might, as experts, we know so many things. You read so many papers, you keep up to date with research. But when you meet a client, you give them something practical. It can be a one-pager, not too much information, unless your client is a lawyer. Not so. Yes, so that's that. And then there was another question to do with, is there any other question I've missed out to do with nutrition? I don't think so. But there's some few things that have been mentioned, like one, maybe the question about policy and how to make sure the youth actually are involved in this process. The first thing I would advise or to support, there's actually data that shows that when a child is trained up on how to eat healthy, they will remain like that far long after they've grown up. So someone develops their tastes and preferences as young as 3 years old. No child grows up craving this deep fried and every other kind of food. It's just our conditioning whereby we tell them, if you do well, I'm going to buy you a sausage. You get it, eh? If you do well, I'm going to buy you fried chicken. So you create that reward system in their mindset, and it builds up so much that when they grow older, they think that I am going to treat myself to a bowl of ice cream. It's a treat, right? Nobody says I'm going to treat myself to a salad. No one says that. You get it? Eh? That's a cultural challenge. So first of all, it would have to be in the schools. You'd have to advocate in schools, maybe speak to the youth while they're still young. The policy has to be there, but I know some policies are already in place. I can speak with authority because I'm also the publicity for the Allied Nutritionist Association of Uganda. So I know that there are some policies in place that are happening. I've also been awarded by the Nutrition Society of Uganda for innovation. So I know that there are so many things that, okay, thank you. I also know that there are so many things that are actually in the pipeline to help children in such cases. But also creatively, right now our generations, you find that people on a lot of social media, TikTok and other social media platforms, whether you can follow us on Become a Nutritionist, we're on TikTok. But the aim is to, first of all, push into their spaces and make this education more interesting. They don't want to see you with a collar, with a white coat, even though we have those many scrubs. You'd like to be a bit more relatable to them. Let's say on the social media, speak their language, crack a few jokes. Don't be too serious as a medical professional or a dietitian. The last thing was about case reports and publishing. In terms of data, I think that's very good advice. Personally, we actually keep our data. And I think there's a student who approached us to want to publish that information to see how people adhere and what results they get to when it comes to this complementary intervention, to do with that especially. So that's a good idea. I think we're going to follow up on that. That's basically what I can say in response to what you have asked so far. And in case there's any more questions, I'll be happy to take them. Thank you very much.
All right. Okay, thank you, Ivan. Dr. Foos, anything that you'd like to add on or any response or clarification you'd like to make?
Thank you. Interesting. Who pays for the service? I think that's one of the interactions that came out quite boldly. Someone who has also done insurance in the past. Maybe the insurance people here are a bit timid to say the facts. By definition, insurance is basically safeguarding you against an unknown risk. And the conversations that we are having right now are preventive in nature. They are known risk at the time, I would say. Why I say known risk: if I eat bad food, if I do not sleep enough, that's known risk. So in terms of capping their claims, that becomes an issue. Post-COVID, with the pressure from the public, having seen quite a number of patients newly diagnosed with chronic illnesses post-COVID, they did introduce a small wellness package, which I know goes about 250,000 per annum within the cover. However, if someone definitely had an accident and they needed physiotherapy as part of the rehabilitation process, this is covered because the entire risk of the accident is basically what is covered. But walking in and you need physio, may not be covered. Why I'm stating this is, again, just to try and empower us that part of our health is our responsibility. We know that all of us, I do not know, starting from the workplace where we work, if we have occupational therapy in terms of evaluating our ergonomics. I know most of us here have at least had back pain in the last couple of months, at least. The traffic jam in Kampala is immense. We sit in office quite long hours. And these, we already know the causes of some of the simple issues that we have. We are able to go to the spa and pay for a massage for someone who we haven't really told what our issue is, to someone who may not educate us on what the causes, what the root cause of our pain is. And I think for Sana, this is one of the big issues, is that how do we then get ABT and other players in the space of complementary services up to the top? How do we define the difference between what we are trying to achieve today and the SPA? So these are the conversations that we will keep on going. Sana has given us a platform, and for me, I do not want the conversations to stop today. We proceed on a daily. Do we have weekly CMEs, monthly CMEs, engage different populations? We've seen things like antenatal classes have been picked up quite often. So I imagine if I was feeling a little low on Saturday, I can log into a talk show on mental health, and this boosts me. So in terms of financing, that might be a challenge. We've also come across other packages sold under insurance, like life assurance. They assure your life. 10 years, you get your money with your profit. This is more geared around saving for the future. So we want to come for these services. I know that the physiotherapists are such sweet people. They teach you all these activities and exercises you can do even without having to pay for them, even without having to keep coming back. And they will give you all these warning signs that you need to know, then come back. So that's the conversation around insurance. I know it's in Stephen's policy and growth and where we want to go. So I just thought I would give it a little bit of time and attention. There was a question on how does someone access all the services? I think what I understood is maybe when I come in, I see the nutritionist, I see the physio, I see the... Well, I think it's you take in the service one at a time. Again, through the different classes we can have is for someone to understand which service do I need, when, how. Someone spoke about having been able to increase their weight. I think I was also underweight about 3 years ago. So same journey. And we need to simply tick off a box at a time. Otherwise, if you told all these corporates here that come to ABT and walk through 5 services at an average turnaround of about 30 minutes each, it may be a bit cumbersome. So when we educate the population, then they are ably going to choose what they need, when, how, and they will engage in that. Yep, I think that's it for me. Thanks.
Thank you very much, Dr. Fawuz. Leona, you have something to add or response? Thank you.
Am I audible? Yes. Okay. So, firstly, I would like to mention that I am actually one individual here that uses everybody's services here on this panel. I have been to Ivan. I think he's a remarkable nutritionist, and he has helped me with a lot. Keep in mind that I'm also a clinician, and I've also been in clinical practice for a long time, and should be too wiseacred to use these services. I use them. I've been a member of IHK, which is now CCare, for maybe 20 years now, maybe. And they're doing a great job. And they have wellness packages that I intend to partake of this Monday for sure. Yes, I am a member of this health club. I work out here every Monday, every Tuesday. I do boxing on Wednesdays, amongst others. I have used their IV therapies. I didn't know that there is such a thing as not feeling exhausted after 4 p.m. I just thought this is how I'm built, you know? But there is such a thing. There are solutions if you look to them. The real question, I think, is why do we not prioritize wellness? You know? Why do we not? You're asking in schools if the teachers are trained, but why do we not prioritize health? You know, we don't really think about. We have 99 problems until we have a health issue. Then we have only one problem. But why don't we prioritize it? You know, does our government prioritize it? Let's start there. From the national budget in Uganda, only 4% goes to health. Only 1% of that 4% goes to mental health. You know, we have 500 beds in Butabika Hospital, and we have 2,000 inpatients at any given time. You know, why do we not prioritize wellness? It's very vast. It's very, if you take it to institution, it's institutional, it's bigger than us. But for us as ourselves, we really have to learn to take the onus onto ourselves and hope that we teach others by prioritizing our own health. Because a lot of why we don't prioritize our own health is probably psychological barriers. You know, we are looking for immediate gratification. Going to the gym is not going to give you that immediate kick, like eating a chocolate or drinking a beer, or, you know. Maybe we also have this positivity bias, thinking, cancer is for the other guys, not for me. things like that. But the very reason, if you look at yourself, and most people here, I believe, are in the health sector, if you try and understand why you yourself are not prioritizing wellness, then imagine those who are much less informed than you are, then that can help to answer your question of the government and are we prioritizing this with our children? No, we're not. That's the answer that I can honestly give you. I think in the healthcare system that it is imperative that healthcare staff recognize the value of these approaches. We have so many doctors in the house today, and that's great because complement approaches, unless you really not prioritized, they're really not prioritized in the healthcare system. I don't see them be prioritized. I work under insurance, one of the insurances that I find to be quite, maybe it's my voice. One of the insurance companies that has really been effective for me in terms of how far they've gone with their mental health sector is actually Minette Insurance, where they've put down actual structures. They've put down actual structure wellness programs alongside standard health care. Most people in the healthcare system, when you talk to them about wellness, they're talking about massages. They're talking about what is that? There is a way in which we diminish the importance of these approaches in healthcare. Maybe it's because they are preventative. Maybe it's because it's a capitalistic world and we all need to make money. Maybe, I don't know what the reason is. But I think that if you develop structured wellness approaches alongside healthcare, alongside standard healthcare practices, that would be a really prudent solution to a lot of healthcare issues. And I also, there's a gentleman who talked about doing research. I wish insurance companies and healthcare companies really invested in research, because we need to monitor and evaluate and the outcomes. We need to track patient progress. We need solid reasons. We need empirical data to say, here is how mental health practices are actually helping to resolve issue cancer. Here is how physiotherapy is working in collaboration with hospitals to solve the problem. We need stats for that, Solutions don't, we need money. To have money, we need research and numbers, okay? So HIV used to be a killer disease, in Uganda, and then research was done. People started to, this is how the stigma was lifted, right? Research was done. People started to come out and talk about their HIV status. A number of people, before that, if you were found to have HIV, you'd go to the village to die quietly and shamefully. So which company is going to put money towards that to actually find solutions? When we start to lift that stigma, when we start to educate ourselves on these real solid issues that are going on, then companies that have the money to do the research and we come up with medication and real solutions, then they're interested because there's numbers. But where we don't have numbers, we're just in a free fall, It's just you're talking about wellness, people are hearing neck massages and I don't know, candles. I've had a lot of talk about self-care and, put on some candles when you get home and, I, I don't know how effective. I don't think that is, if you've had a bad day, I don't think there's anything a candle is going to do, let alone neck pain, let alone hypertension. And it's not to diminish self-care, but we need real solid solutions. Thank you.
Okay. Thank you very much, Leona. In one way or the other, we have already stepped into our third session. She has already hinted on some of the practical steps that institutions can take to integrate complementary medicine or wellness services in that regard. Now, I would like to turn it to Peter. Peter, you had a question. I think someone was asking about how much exercise is enough. You'll hint on that, but also I need you to hint on the direction in terms of growth and how policy and the future of complementary medicine in Uganda in comparison with your experience in the UK. Thank you.
Thank you. I think the doctor mentioned the recommendation in terms of exercise. In the UK specifically, we have a broad, so it's not really broad, it's, through research and understanding the population, they've concluded with what we suggest as recommendation in terms of exercises. So a specific amount of hours a week, depending on your age and your medical background initially. So they've broken it down into age, and they've, for example, somebody between the age of 18, from 15 to about 25, the recommendation amount of exercise may be about 72 hours a week, or it could be 3 days, of specific amount of exercise and a specific type of exercise as well. So doing resistance exercise, it will be very different to then doing cardiovascular exercise. So we've sort of grouped all the exercises. They've sort of formulated, divided the population in number, in age groups, and they've made those recommendations based on the studies and the literature out there. There's another doctor there. He kindly mentioned something about policies. In the UK specifically, we are evidence-based driven. So everything we're doing in the medical world has to be there has to be some evidence. And it's upon us clinicians who work in this healthcare system to sort of provide some sort of resistance. So, okay, for example, if there is an issue with the insurance and the insurance can only fund 3 sessions of a physiotherapy, we know as clinicians that 3 sessions is not quantity enough. Put it upon ourselves to sort of say to the insurance company, yes, you can only afford to do 3 sessions, but in theory, you can't get the results in 3 sessions. So it's whatever you're offering, based on the literature that's out there, it's not going to help. And that's how we sort of start. So the resistance in terms of the insurance, I think Fiona's mentioned a few bits, and some of the members here have touched on the fact that, the insurance companies, they will give you that resistance. But we as clinicians, I believe, it starts with us and the data that, the doctor had mentioned, that if you don't have that data, it's then very hard for you to, it will be very subjective. What you feel or based on your experiences isn't enough. So when you get to a certain realm, you figure out that the numbers play a role. What literature says, depending on the person, depending on the pathology, depending on the condition, also plays a factor. In the UK, we've got stuff, policies that come out, every 2 years, 3 years. For example, I'll give you an example, the stroke. Those who work in Euro, the Stroke Association, they release a policy that gives individuals guidelines and expectations on what you need to do. So physiotherapy, occupational therapy, aftercare, in-care, medical, everything's under that guidance. And we as clinicians follow that to a T. So you take that booklet to the insurance company and say, well, based on the literature that we have, or based on what, the recommendations of the government, based on the studies that we've started, 3 sessions or, 4 sessions or whatever it is, it's not really going to be effective. You need more. Okay, we can cover physio, but we cannot cover mental health. No, but based on the literature that we have, you have to cover it. It has to be covered. Me being a physiotherapy, coming in with somebody who had a stroke, but we know that, the likelihood of them having something psychologically wrong with them, or, how they interact with mood swings and how they interact with the rest of, the population. If we don't have that, then it's, whatever I'm doing as a physiotherapy is not really going to be effective. So the policies that we're talking about here, very good, and it makes perfect sense. But it has to be driven by data. We have to have the numbers there. If we don't have the numbers there, you can take it to whoever. They'll look at it and be like, well, no, it doesn't really make sense. And you could use that to say, well, no, what we're doing is actually not effective. It's not enough. Because based on what we know about this pathology, this condition, it's not really working. We need enough. We need more. And that's the only way we sort of maneuver through the UK and the difference between here, based on obviously the discussions we've had today. The only thing that I'm really seeing that's maybe a bit different is, the use of evidence-based approach to sort of quantify, we clinicians, what we're doing, as opposed to, oh, can we get the results? Can we not get the results? Even us within, I was talking to Ishmael, and that he mentioned to me that's still lacking here. Everyone guards and protects what they know, and they're not really happy to collaborate with other members within the healthcare system, whether it's private, whether it's the NHS, which is public healthcare. You have to. That dialogue has to be there. You have to be able, because we don't know everything. So if I'm unable to sort of have a conversation with the doctor because I think, oh, the doctor is gonna operate, or so he's gonna take the client away from me, I'm putting the client at risk. But these could be conversations and discussions that you have with whoever, not to say that, well, no, my approach works, but can we come up to a common goal? What's making sense? What doesn't make sense initially? But, based on the conversation with Ishmael, he's mentioning, people tend to have that approach of, oh, I know this, so I'm going to keep it to myself, and I'm just going to use it. I'm not going to share it with the rest of the world. Number one, that approach doesn't work because you're limited to what you can know. If all you know is this one thing, the urge of, the desire for you to know more stops because you feel like, oh, I've got the gold. This works for me, but you can. And as we've mentioned here, we're all human beings. So what works for him will not work for you. So if I know something that worked for him, and I feel like, oh, I'm gonna really quantify and just use that, generalize that to the rest of the population, you're missing something. So that's the only thing that really stood out for me throughout, some of the things that we guys have mentioned in terms of policies, in terms of insurance. That is sort of how they navigate that issue. Because believe it or not, insurance companies in the UK, they don't want to give the money. They won't give the money. So what you can do is, if you present the evidence and say, well, based on X, Y, Z, the patient needs this care, you have a better conversation, as opposed to saying, well, we can only offer, because they're not medicals whatsoever. Yeah. But we, the clinicians, have that role, and we have to play that role. Yes. Yeah, that's it. Yeah, thank you.
Okay. Apologies, ladies and gentlemen. I would beg and ask you for us to have a 5-minute break. I can tell that people are itching to stretch or take a walk or go use the bathroom. So I'm going to ask us to have a 5-minute break, and let's jump back into, and then we'll start with Solomon. Okay. I'll let Solomon supplement something small, then we'll get into that break.
Thank you. My name is Solomon, a physiotherapist in Uganda. I just want to supplement and answer the doctor's question in the Ugandan context. What exercise is? What is recommended? For someone who is 18, this is research based on Uganda Physiotherapy Association. So we borrowed from World Physiotherapy, then we intervened it into Ugandan context. What do we need as Ugandans? Because we are talking about Uganda now. 150 to 300 minutes of moderate exercises for someone who is 18 to 65 years. Then 75 to 150 of vigorous exercises. These include running. We won't focus so much on swimming because swimming is not our thing. But if someone can run at least in a week. Then for someone who is elderly, we encourage physical activity. What are physical activity? Things we do daily. Because this is someone you're not really going to subject to a treadmill or run or do something. But if they can do something in their home, that would be very good. Then for children, these are left out now. You see schools that are built and they are left with no, that pitches are being sold off. So all our schools are storage. But we encourage kids to do at least 60 minutes a week of activity, anything they can do, play. Then as someone who is 1 to 5 years, we encourage play. Leave kids alone at home from 1 to 3 years. Let them stay at home and play. Stop taking kids at school at 1 year, 1.5 that you're doing daycare. They're not playing, they're reading. Then toddlers, we encourage tummy time. A toddler is 0 months to 1 year. We encourage a lot of tummy time. Keep the kids on their tummy. They'll be able to lift their head. Our bodies are meant to get up and walk. So if they're always lying on their back, they're not going to play. Keep them in the tummy time. Thank you.
Okay. Thank you so much, Solomon, for that important information. Let's break away for 5 minutes, and we'll be back and just dive extensively into growth policy and the future of complementary medicine. Thank you so much.
Hi everyone, my name is Ismail Sina and I'm one of the directors. Patient know it as ABT. Okay, before Activate Body Therapy started, I used to be self-employed. I used to treat so many people that had injuries. Due to overwhelming demand with people with lots of pain, injuries, and not being diagnosed properly, we ended up opening Activate Body Therapy. We formed a team of professionals. So those team of professional therapists and wellness professionals had to be trained. And we trained over the number of years, and then we opened up the Kololo branch in Kampala. How we work different to any other establishments or other centers around it is because we take care, we approach everyone differently. So we look at individuals, and then what we do assessment, we do the history, and also we do the previous treatment. Then based on that, then we formulate a treatment plan. The treatment plan is mainly looking at therapy. We look at the manual therapy, we look at electrical therapy, and also we look at exercise therapy. And that's our approach, and that's what makes it different. And also we do phases of treatment, and we do evaluation, and depending on how they progress, they move on to a different phase of treatment. Activate Body Therapy specializes in pain management, rehabilitation, exercise therapy, weight management, physiotherapy, chiropractic service, vitamin infusion, and many more other services. The way we treat our patients, we start with consultation. The consultation, we gather information. The information is based on the treatment, on the injury, and also the history of the injury. Then based on that, we're able to formulate the treatment plan. The treatment plan normally happens in phases. So we have phase 1, which is pain elimination. That's geared to taking away the pain. Then phase 2 is about treating the cause of the pain, which will use exercise and also other treatment such as tissue work. Then phase 3 is just about making sure the pain doesn't come back. And then phase 4 is the maintenance. At Activate, we have a team of professionals that I'm very lucky to be working alongside with. Hi everyone, my name is Ismail Sina, and my name is Ismail Sina, Director of ABT Clinic. At ABT Clinic, we believe wellness goes far beyond than just a treatment. It's about prevention, recovery, and building strength in every single day. In this month of September, ABT Clinic is proud to be part of World Physiotherapy Day and creating awareness how physiotherapy is important. When we set up ABT Clinic, our vision was very, very simple: to bridge the gap between medicine and wellness. Too many people stop aftercare once they leave a hospital, and we believe this is the starting process of healing through exercise, manual therapy, and lifestyle adjustments. This month, ABT Clinic would like to show you how physiotherapy can transform your health journey.
In case you're wondering what physiotherapy is not just an exercise, it is also a treatment that helps you restore movements, help you recover from pain, and prep you for your future. The categories of people we deal with are people having injuries, recovering from surgeries, chronic conditions, and anyone that wants to live better, move better, and perform better. When you visit Activate Body Therapy, we start with a consultation that helps us understand your personal needs. Then we'll design for you a program that will help you go through the steps of recovery, including treatments like manual therapy, electrical therapy, and many more others. In short, physiotherapy is not just about healing, it's about living your life fully without being held back by pain.
One of the biggest misconceptions about physiotherapy is only for athletes or people coming from surgery. Yet we believe physiotherapy benefits everyone.
Here are some of the benefits of physiotherapy. 1, pain relief. We use targeted techniques to relieve pain naturally. This helps us to prevent long-term medication. The second benefit of physiotherapy is faster recovery. Be it from accidents or injuries, physiotherapy helps in the faster healing process. The third benefit of physiotherapy is better movement and strength. Here at Activate Body Therapy, we offer movements that improve on your flexibility and strength in your body. The fourth benefit of physiotherapy is we help to strengthen the weak areas in your body and help on improving your posture, hence preventing future injuries. Long-term wellness is another benefit of physiotherapy. It is to improve the quality of your life. It is not all about fixing what is broken.
These benefits are why we call physiotherapy a lifelong investment to your body. At ABT Clinic, we combine advanced physiotherapy techniques and treatments such as electrotherapy, cupping, and dry needling, and many, many more to ensure that each patient receive exactly the right treatment the body requires. As we celebrate the month of physiotherapy, we encourage you to take this journey with us. Don't wait for the pain or injury to occur. Take charge of your wellness today. Hi everyone, my name is Ismail Sena, Director of ABT Clinic. At ABT Clinic, we believe wellness goes far beyond than just a treatment. It's about prevention, recovery, and building strength in every single day. In this month of September, ABT Clinic is proud to be part of World Physiotherapy Day and creating awareness how physiotherapy is important. When we set up ABT Clinic, our vision was very simple: to bridge the gap between medicine and wellness. Too many people stop aftercare once they leave hospital, and we believe this is the starting process of healing through exercise, manual therapy, and lifestyle adjustments. This month, ABT Clinic would like to show you how physiotherapy can transform your health journey.
In case you're wondering what physiotherapy is not just an exercise, it is also a treatment that helps you restore movements, help you
Ladies and gentlemen, let's get back into our seats. We need to wrap up this discussion, and we'll be starting in about 30 seconds. I'd request the panelists to take your seats. We'll be missing one panelist, Leon. policy and complementary medicine. We'll keep it a little bit short because we've run out of time, but would like to inform you that this conversation will stay open and will keep going on even later with the networking. So my first question is going to go to Ivan. Ivan has thrown more light on nutrition and how that is going to be a future forward role taking on wellness. Ivan, would like for you to share on how restoring gut health plays into holistic wellness.
Okay, thank you very much. Firstly, I think this is a very opportune question because I have a yogurt parfait here prepared by Activate. So this is really good for gut health. Eh? So the first thing I want to mention is this. In terms of gut restoration, it's been known that the gut is like the second brain. If your gut is not feeling well, your mental health will suffer, deficiencies are prone to you, the constipation and other challenges can actually make you very unproductive at work, at school, or at home. So when you restore someone's gut, it's like the beginning stage of having someone to have a holistic well-being. It's like a center stage. Gut has linkages to nutrition. Those are deficiencies and all that. It has linkages to someone's mental well-being. It has linkages to someone's immunity and much more. So gut restoration can be done. Usually if someone has food sensitivities, has allergies, or just simple gas and bloating or constipation, they can be taken through an elimination process where they can remove the foods that are culprit foods, the common culprit foods. For each individual, it's different. It's not the same for everybody. And then you can replace them with the gut healing foods. That person can be restored gut-wise, and then they can be very functional and productive. Not only at the workplace, not only at the home, but also able to do other exercises and other important complementary interventions. That's what I can say about that. Maybe just to say one last thing about it. When it comes to gut restoration, it's not always just about the medical side of it, because I know that they give a lot of antibiotics to help with gut challenges. But at times you might require a probiotic afterwards to make sure your gut is rebalanced. Then maybe a prebiotic like the yogurt or the fiber in the granola and other things to actually restore you. So gut health is so pivotal when it comes to someone's holistic well-being. That's to answer your question.
Okay, thank you so much, Ivan. And now we're going to turn to Dr. Fawuz, who's going to just throw more light on what the growth and policy and the direction of complementary medicine in Uganda is going to look like for the future.
Thank you very much. Good afternoon once again. We'll be back from that stretch. I hope Peter was engaged in which exercises to do. But we've basically touched the most of the growth areas. But what I would like to add is one of the things that Solomon raised earlier, national guidelines. I was very surprised that the Physiotherapy Association has some guidelines and I have not come across them. So I am like you. I want to have access to these guidelines and know what is supposed to be. And then we can again proceed to teach this to our patients. In terms of accreditation, we've quality accreditation. We know that the hospitals have JCI, ISO, and so we need to also have accreditation for our services, and these basically differentiate us properly from the spas, from the other things that we consider physio, so that we get this from trained professionals and then be able to benefit from this. Research is a key aspect, and us ensuring that our case stories and our data is available to the public. This definitely helps us push the agenda. And that said, all these other things will be done. My request is that we keep the conversation going, and it all starts with us. We have to be deliberate from the word go. Let's not wait for pain to set in, for illness to set in. Let's have a plan. And then we are able to live a healthy life. Thank you.
Thank you so much, Dr. Fouz. He touched on research. He touched on accreditation of our services so that we're easily identified, but also to understand exactly what services are being provided. I think another aspect on this is that is very key that should be taken into very high consideration is collaboration. And now, to wrap up and close this very important conversation, I would like to give the mic to Ismail to just also throw more light on growth and policy and the future of complementary medicine, since you're largely in that space. Thank you.
Thank you. Before I begin, I'd like to take this opportunity to thank all of you for coming today. Normally they do it the last, so this time I'm going to do it, change it around. Particularly, I'd like to single out a few individuals, so especially our clients that we treat at ABT. I'd like to start with Honorable Joy. Well, thank you for coming. And also, I'd like to say thank you to Emma, our client. Those who don't know Emma's had a long journey of medical illness. So Emma had a brain tumor that was half removed. Then later on, she found out it's still half. So she had to go for medical care to be removed. So when she came back, we had to do the rehab. So hence that's where you can see Emma here. So as to summarize up to all of us what we've been talking about, I'd like to go through, as I said to you before, prevention is better than cure. You know, don't wait for pain or illness or any disease to come. Let's take preventative measure. Let's look after ourselves. Let's look at our bodies. Let's do checks, as the way the doctor said. Don't wait until you're ill and then you go and do checks, a blood check. Always do regular checks. So that's what I would start to say. Always engage in exercise, nutrition, and the most important thing, which I tell all my clients, your rest is very, very important, because we all know during the rest, what's happened to the body. The body rests, okay? That's where the growth happens. That's where the repair process happens. If you're not resting, you're not ticking those boxes. So I'd like to say, in terms of that, prevention is better than cure. Then we'll move on to treatment. We've all been here talking about way forward of treatment, complementary and conventional medicine. I'd like to focus on saying that let's look from today's conference, let's take a holistic approach, okay? Not just medical convention, but also complementary. They both work hand in hand together, depending on where you are. So if you have an injury, let's an example, you have a swelling, that swelling has to be managed. It can be managed through medication, and also rest. So once the swelling is gone, then the holistic approach of rehabilitation can happen. So it's very important for you to treat the pain through a holistic approach. Then moving on to future of medicine or complementary medicine, I'd like to say, since we're all here, we'd like to create more awareness. More awareness in terms of conferences, seminars. We need to educate the public, because at the moment, as the way everyone's here, it's a new topic. Some people don't know where to go. After being discharged from a hospital, the doctor tells you go home. What next? So we need to create awareness through seminar education. And also, another thing I'd like to say, since we're all here, we really need to form partnerships. Partnerships through doctors and medical practitioners. And then from there, we can have a group of us that we can approach the government in terms of how we can develop this. Development can be through registering, first and foremost, all these medical practitioners. Then the next one is about how do we regulate? How do we develop self-practices? Because at the moment, you have complementary and also convention. The convention might say, oh, we're not sure about the complementary. And the complementary might say, you know what, the doctor's saying this and this, but we don't think the same. We really need to start working together, because at the end of the day, if we work together, we're developing a common goal to treating patients. Then in terms of another one, I'd like to say public acknowledgement, a public being able to know what's happening. And then the last one, growth policies. I'd like to mention in terms of growth policies, forming partnerships with government agencies such as Allied Professional, Ministry of Health. Another one that would be Ministry of Education and Sports. Because I know someone said, how do we progress or take this idea to start from the grassroots, from primary? This can only start through Ministry of Education and Sports. Start teaching the young ones at a young age so that they can adopt and also create a better understanding. And I'd like to end on that note. And if you have any question, please let me know.
Okay. Thank you very much, Ishmael. He has touched on a bit of everything, right from the growth, considering holistic approach to our health, and also the future, looking into keeping this conversation open and creating strategic partnerships that will lead us into approaching the necessary government bodies to formulate policies that will help take this forward. And now I'll turn to the audience if we have any reactions. If we have any reactions, you can put up your hand. We'll be approached and given the mic and the chance to speak. But for now, I think let's listen from you, Ivan.
Thank you. Just want to, first of all, add my voice to what
education and sports and the Allied Health Professionals Council. We can also do some partnerships
with different small and medium enterprises. This can be by them actually looking out for their staff through corporate wellness programming. It can be through the SMEs, the medium scale, or even the corporations. The actual companies can be very useful partners on board to make sure that this type of care is incorporated in their well-being calendar. It could be through workshops, maybe where we come and speak and create the awareness to their staff at the workplace. You know, most of the average corporate person spends about half their life at work because you spend almost 8 hours plus at your workplace. So if wellness can find you there, it could be a health screening, it can be signing up for memberships like the club here at ABT, it could be a nutrition program, it could be medical something. Basically, you have a chance to find at your workplace, because not everybody is allowed to leave their station because of the kind of work they do. And then that builds into corporate wellness. So the companies themselves, if they're profitable, they can actually invest money in their wellness of their staff. Get them some subscriptions, get them some services. This will help your staff become more productive. Research shows that over 70% of the Ugandan population are burnt out and stressed. Yeah, you find that 90% have lots of trouble when it comes to staff, the losses and productivity, just because of the lack of the staff is unwell. People are stressed out, burnt out, maybe having chronic illnesses and disease. So this will actually make much more profit, not just to the organizations, but also very good for their people and for our economy at large. So wellness can be something we can put in there for policy, but as a way to actually help us have more money on the table in terms of profit, but also to have a more productive workforce. That's what I wanted to add my voice to. Thank you very much.
Thank you very much, Ivan. Any more? You have some questions? Okay.
It's just a reaction. It's good afternoon, everyone. I'm Moses Ruwama. I'm also an advocate, a lawyer, like my land friend here. I'm so happy to be part of this conversation and dialogue. Suggest that next time we have a dialogue like this one, I would suggest that we have a member from one of the government agencies, like from Ministry of Health, let's say a representative from any government agency. In that way, it would help us to advocate for why we are here. it would help in bringing awareness to the other people who are outside here. Other than that, I'm just so happy to be part of this. Thank you so much.
Thank you so much, Mr. Luwama. Let's have a few more reactions.
Thank you so much. My name is Obia Michael. My professional background is pharmacy and also public health. And I wanted to begin by saying that I'm very grateful to be here. It's been very insightful listening to all the professional opinions from you guys about complementary and alternative medicines. I wanted to just get some perspective from you, specifically maybe those who've had experience with handling patients who have experienced lower back pain, say from disc herniation. I say this because a couple of years ago I used to play professional basketball, and a lot of the folks used to have that particular complaint, and there never was quite a very clear consensus as to what was the best approach for medical treatment. Some folks would go to some clinics and then they would tell them, just go and rest it off. Some folks would go to some clinics and then they would tell them, you go and walk on it. Others would go and then the answers were not very specific and they were not very clear. They didn't have a sense of how severe their problem was or what they themselves could do to aid in their own recovery. And it only took maybe a colleague of ours who also happened to be an orthopedic surgeon to come and give some of these folks some insight into some of the best approach for dealing with lower back pain. So I just wanted to hear from you guys what you think the best strategy is for like long-term recovery, for better prognosis, but also how patients can be a little bit more evolved in their own recovery, but also how can complementary medicine also be integrated into helping these guys recover and perhaps even go back to fully participating in sports and being a little bit more active. Thank you.
Okay. Thank you, Michael. We'll have a response to that. Solomon, you had something to say?
Thank you. In regards to policy, one other thing I would mention is stemming back in school, like practice, scope of practice for physiotherapy or like medicine. If this could be integrated into the curriculum, like when I was in school like 10 years ago, we only had one physiotherapy school in Uganda. Not until Barara opened up, and like Barara is doing very well with advocating for physiotherapy, and like because they knew the importance and they integrate, like even Barara medical students have to do some courses in physiotherapy. So they know by the time they graduate, they know what physiotherapy is. So if these policies were made into a way that even this complementary something like acupuncture, yoga would be incorporated in physio, I think physio would advocate more for complementary because they know what it is. And like I said in the beginning, physio bridges the gap between the medical and because we know the physical treatment and the medical chemical treatment. So that would really help.
Okay. Thank you, Solomon. We'll have the last one from Dennis.
Hello, good afternoon. My name is Dennis. It's like I introduced earlier. I'm a strength and conditioning coach with over 25 years in the health and fitness industry. Just kind of adding on to what my colleague just said, the physio. I think a lot of our job in the fields that we work in lies in educating individuals and empowering them with the knowledge necessary for them to be able to help themselves. Also, what we're seeing generally, especially since COVID and since the lockdown, a lot of people decided to take the responsibility for their own health. The medical fraternities don't have all the answers, and I think in the more that people take responsibility for their own health and do research and so on and so forth and gather as much knowledge as possible, the better everybody's health will be generally and all round. Um, the I like the point about where physiotherapy kind of bridges the gap between the medical and complementary therapies and things like that. But what we're seeing is as well nowadays is a lot of going back to a lot of traditional therapies that used to be very, very effective and very useful in terms of helping people holistically. And also just kind of echoing what Ishmael was saying about prevention being better than cure. So in the areas that we work in, when it comes to rehab, there's something called rehab, but there's also something called prehab. Prehab. So it's important in my practice generally. I'll speak personally. I put things in place that will that are preventative, especially when I'm working with people that might be susceptible to certain, So we're talking about back pain. When it comes to back pain or back problems, there's three types of people. There's someone that currently has back pain. There's someone that's about to undergo back pain, and there are those that are recovering from back pain. So it's something that affects everybody. And what we try to do in our practice is putting things in place that ensure that once somebody has recovered from that back pain, it's part of their program to ensure that that the core is strong, the back is strong, certain muscles or certain structures that are too stiff or too tight are loosened, and certain muscles or structures that are too weak are strengthened, and so on and so forth, and then kind of maintaining that going forward. All right, thank you.
Okay, thank you so much, Dennis. Do we have that response maybe from Ishmael on the back pain?
In terms of back pain, I thought we can answer it two ways. So I can tell you what causes the back pain, how can it be treated, and how can you get back to your sport, isn't it? So in terms of, you have to look at back pain. Everyone in this room, at one point, you will develop a back pain, okay, if you haven't, or you have, okay? So what we need to look at, what causes the back pain? So number one is the wear and tear. Imagine if you have a car and you drive it for, let's say 20 years, what's going to happen to that car? It's called wear and tear. How do you do it? So there's a number of ways you can manage, and also going back to Dennis, how to prevent it from happening again. So we have to look at wear and tear, the tissues are tight. So number one, just to make sure, we have to look at anatomy of the lower back. What's in there? We have tissues, we have bones. So in terms of most of my time when I'm approaching a lower back pain, I do assessment and I find that the common questions I ask, is it tissues? Do you feel it's a muscle or it's a bone? If you tell me it's a bone, I normally refer you to have a scan to make sure there's no damage to the bone. And if you say it's a muscle, I said, okay, let's work on the tissue. If the pain doesn't go away, you will need to go for a scan. So I make it clear before the beginning. So once we started, if I find that it's tissue, we do some tissue work to release the tissue, because at the end of the day, the tissues are complaining. They might be shortened. The nerves might be irritated. You might have trapped nerves. So depending on that, the way we will approach, we do some work, light tissue work, soft tissue manipulation to release the tissues. We also do some mobility work. Our job will be to take away the pain. Now you have to think about, how do you take the cause of the pain? What caused it in the first place? It could be overtraining. It could be coming from work. You haven't invested in the body to train. Because a lot of people in Uganda and also in UK, coming from there, they use sports or movement to be fitter. It should be the other way around. You should be fitter to play sports. Okay? So what we do after I deal with the tissues and the tissues okay, then you have to do exercise. So that's why I said to you, I'll answer this bit, and then Peter will be able to answer, how do you get back to your sport? Okay?
Thank you, Ishmael. Just quickly, based on the conversation on your lower back pain is an issue also in the UK, in the Western world, United States, everywhere. It's an issue. It's an ongoing issue. And there's a lot of funding behind research in terms of what are some of the triggers, how do we manage lower back pain? Because it's an actual concern. Based on my experience and what I've seen and the people I've been around and interactions I've had with other clinicians, again, it's about lifestyle, as you've mentioned, Ishmael. Your lifestyle plays a massive role. A lot of the times, Ishmael points the fact that some of us are going to be in a position where we have pain in our lower back. It's not because it's something that you're born with that's going to happen because of the lifestyle you have. In terms of like how I deal and manage lower back pain, so again, not to get too technical, but it depends on how it presents itself, how long you've had the pain. Is it something degenerative? Is it something that's acute that's happened? Is it caused by trauma? You tend to find a lot of people that have what we call that degenerative changes. The older you become, your bones change, your tendons, all of that, they change, and they wear and tear, as Ishmael mentioned. In terms of returning back to what you want to do, again, it's patient education, which is very, very important. Do you understand what's causing the pain? Do you understand the anatomy? When you do this certain position, do you know why that pain comes? And then looking at your 24-hour pattern. So what do you do for work? Do you have any issues in your, during sleep? Do you sleep well? Because again, sleep, as we mentioned, is a factor that's quite important. Once you've gathered all that information, then we look at, okay, setting clear goals for you. What do you want to do? I want to get back to walking. I want to be able to go up the stairs. I want to be able to get back to running, playing, whatever it is. And then we look at that and structure out, okay, you want to get back to playing football or you want to get back to running, whatever it is, identifying based on the biomechanics that we carry out. Biomechanics meaning, how you walk, your locomotion. How do I walk? What's your posture looking like? Is there anything above your lower back pain that could indicate or contribute towards the pain? Is there anything below in terms of weakness and, reduced range of motion, the whole jazz? We then identify that and then we specifically start working on that. I don't think it'll be quite hard for, to create a policy that will, generalize how to deal with lower back pain, because lower back pain, as I mentioned, is not something that is triggered by one thing. It could be a combination of multiple things. Trauma, degenerative changes, and all of those are different in terms of how you approach them from a rehab perspective. Your traumatic lower back issue is going to be completely different to how you sort of approach your degenerative change. So it's quite very, very hard and very vague. The assessments you carry out, I'm sure, Ishmael will carry out, or the members of this team, give you an indicator of, the plan that you need to go forward. Again, my colleague, physiotherapy, mentioned in terms of, introducing a policy in high school where, students are really taught what physiotherapy is, which is a very good idea, actually. In the UK, speaking for the UK, what we do is physiotherapy is a higher education. So it's a degree that you need to attain. And the reason I think they do that is, physiotherapy is not easy. And I think everything else, even dietitians, doctors, this is they're very hard. And the demand and the stress that comes with you trying to achieve this, it's not for the faint-hearted. So you can't go in thinking, I want to try and see, it sounds cool. I want to try and do it. Your heart has to be there. You can't go into it based on the fact that, I might make money or I might be successful being a doctor. They'll tell you it's not going to work. The reason why they have it in higher education, we're talking about university level initially, is because you have to be really, first you got to demonstrate that you have the knowledge, the foundation in terms of your, biology, chemistry, all of that, understanding your anatomy quite well, and then the demand that comes with the study in itself, because it's not, it's very hands-on, and it's very practical in terms of, the degree and, the profession itself. So the experience has to mimic that, which I think will be quite hard if you're doing that in like a secondary level or, sorry, I didn't get the question. Apologies. Yes, yeah. But yeah, no, that's sort of the overview that we have in the United Kingdom in terms of the approach. I think that's it really.
Okay. Okay. We're going to have one reaction from Barbara, and then we're going to close this discussion. I know a lot of you have a lot of things to do after here, but yeah, let's wrap it up, Barbara. Thank you.
Sorry, I just to add on, just clarify for you because you asked specifically about disc degeneration and in terms of physio, how we are managing. So you said your team had issues with disc degeneration. So to answer your question, there are levels of degeneration, of herniation actually. It was herniation. There are levels of herniation. So that discs go different ways, they compress different things, they damage different tissues in the body, if you remember some of your anatomy. So depending, we have a doctor at the back, depending on how much damage is in your back, it will determine what physiotherapy you get. What tissues were damaged, that will determine. So you could need surgery, you could be managed conservatively, you could need just rest, you could find that very many things. So it's very paramount that you seek someone that you would find that your team that has 11, how many play basketball on a team? 5. You'll find that all those 5 people on that team they needed different treatment. Their levels of herniation were different. It could, I don't know, posture, very many. So to answer you, it's not specific. Every patient is different. So tell them to consult, seek the services, please.
Okay. Thank you very much, Barbara. Yes. A big thank you to our panelists for their insights and to our audience. You have been a very active and engaging audience. We've had a lot to learn from both our panelists and the audience at large. We have gone beyond the time that we had planned, and only because I believe that this was a very pertinent discussion to have. Over to respond to Moses. It's a first of many, but we take that into consideration. It's very important for us to have representation from the government agencies. That is something that we shall definitely plan for in the times to come. But let's keep the conversation open. This is something that we will keep talking about. I would like to also give a big thanks to Activate Body Therapy Clinic and for putting this together. Activate Body Therapy Health Club for giving us the space to have this happening. And also to Usawa Cafe, which gave us the scrumptious and healthy breakfast. A big thank you to Dr. Fawuz, to Ivan, Peter for making time, and the rest of you. I know your Saturday mornings are usually maybe taking off rest and having time to do other things, family, but you took time to be here with us today. We don't take it for granted. We have your information. We'll keep engaging and making sure that we take this conversation forward. Let's collaborate. Let's, across our different disciplines, let's keep this open, and let's be healthy together. So without further ado, I'd like to close this conversation. Thank you for attending the ABT Conference 2025. We look forward to more conversations. Okay. I've been reminded to thank, we had an online
Hey everyone, my name is Ismail Sena, Director of ABT Clinic. At ABT Clinic, we believe wellness goes far beyond than just a treatment. It's about prevention, recovery, and building strength in every single day. In this month of September, ABT Clinic is proud to be part of World Physiotherapy Day and creating awareness how physiotherapy is important. When we set up ABT Clinic, our vision was very simple: to bridge the gap between medicine and wellness. Too many people stop aftercare once they leave hospital, and we believe this is the starting process of healing through exercise, manual therapy, and lifestyle adjustments. This month, ABT Clinic would like to show you how physiotherapy can transform your health journey.
In case you're wondering what physiotherapy is not just an exercise, it is also a treatment that helps you restore movements, help you recover from pain, and prep you for your future. The categories of people we deal with are people having injuries, recovering from surgeries, chronic conditions, and anyone that wants to live better, move better, and perform better. When you visit Activate Body Therapy, we start with a consultation that helps us understand your personal needs. Then we'll design for you a program that will help you go through the steps of recovery, including treatments like manual therapy, electrical therapy, and many more others. In short, physiotherapy is not just about healing, it's about living your life fully without being held back by pain.
One of the biggest misconceptions about physiotherapy is only for athletes or people coming from surgery. Yet we believe physiotherapy benefits everyone.
Here are some of the benefits of physiotherapy. 1. Pain relief. We use targeted techniques to relieve pain naturally. This helps us to prevent long-term medication. The second benefit of physiotherapy is faster recovery. Be it from accidents or injuries, physiotherapy helps in the faster healing process. The third benefit of physiotherapy is better movement and strength. Here at Activate Body Therapy, we offer movements that improve on your flexibility and strength in your body. The fourth benefit of physiotherapy is we help to strengthen the weak areas in your body and help on improving your posture, hence preventing future injuries. Long-term wellness is another benefit of physiotherapy. It is to improve the quality of your life. It is not all about fixing what is broken.
These benefits are why we call physiotherapy a lifelong investment to your body. At ABT Clinic, we combine advanced physiotherapy techniques and treatments such as electrotherapy, cupping, and dry needling, and many more to ensure that each patient receive exactly the right treatment the body requires. As we celebrate the month of physiotherapy, we encourage you to take this journey with us. Don't wait for the pain or injury to occur. Take charge of your wellness today.